because you have to figure out some kind of a dose, and we don't really have a good published dose on it. But I think it's really interesting that they saw that correlation between, and they looked at 200 nutrients, because that was my question, and the question of other people is, well, how'd you pick DHA?
Right.
You know, there's all these nutrients. Why was DHA the one that you targeted? And their answer was, we looked at 200, and that was the one that we could see a correlation with. So I think it makes sense. And I've had people anecdotally, after they've had that information presented to them, start their bitches on DHA, and they'll come back to us and say, I can't believe these puppies are so smart. Like, be careful what you wish for. Because you might have a puppy that can, do a Rubik's Cube, and you don't really want him to be that smart.
Right, yeah.
But I think it's really interesting information. So yes, the uterus is healthier pregnant than non-pregnant, because you protected it against the influence of progesterone by having the pregnancy. And we do see resorption sites in the uterus at C-sections. You can't really identify them as well if you've just, like if you've done an ultrasound and there were 6 puppies on ultrasound and then you had 4 born, then you would be suspicious that there were either miscounted puppies or resorptions. And sometimes you can see resorptions on ultrasound pretty effectively, and sometimes you're just not really sure if you saw a resorption. But at C-section we can see them, and so when we do C-sections on bitches that have had a pregnancy that didn't lead to the full number of puppies being born, then we're recommending to our clients that we biopsy that uterus at the C-section. So we can take a uterine biopsy where the incision site for the placenta was, and then we'll take a biopsy at the resorption site. And we use a pathologist that's double-boarded in theriogenology and pathology, so he's putting together more and more data to try and figure out what kind of changes we see. Is it fibrosis, scar tissue? Is it cystic endometrial hyperplasia? Was there an infection, some neutrophilic infiltration that tells us there was an infection? We've had one case where there was like an allergic reaction to the sperm, and so we saw inflammatory changes that were suggestive of that. So there's a variety of different things that you can see that are kind of interesting in trying to figure out what the underlying cause was, which isn't going to help you much if you're not going to breed that female again. But if you're going to breed her again, or you're breeding her daughter, then knowing that information I think is really helpful, because then we can address some of those things prior to the pregnancy and after the pregnancy. We've got a dog I saw a client that's here right now that we had multiple breedings unsuccessfully. So we did go in and biopsy her uterus, and we came back with inflammatory changes. So we put her on prednisone, and I don't routinely use prednisone for this. Only if we know that there was some suspicion of a problem. So we put her on prednisone, and she ended up having 7 puppies in her next breeding. So she bred her 3 times with 0 puppies. So we went from 0 puppies to 7 puppies with an appropriate course of prednisone prior to the breeding. You don't want to have them on prednisone during the pregnancy. So there's a lot of information we can glean, and that's one of the things that I did that research, that why we did those biopsies, and why Emmanuel Fontaine from France had put together that data, as he published the paper on that.
Mm-hmm.
And then the pathologist that's doing the work right now at Ohio is trying to put together a study of what normal uteruses look like. So we're going to be starting to collect uterine tissue at C-sections. We wouldn't go to surgery for no reason, but we would go in, and as long as we've made an incision in the uterus, collect some of the uterine tissue, because you can just make the incision just a wee bit wider and take a little slip of tissue that won't impact the bitch's future fertility. And by doing that, he can start looking at hundreds of what normal uteruses look like, because you can't identify abnormal until you identify normal. And there just isn't a lot of data on that yet. So he'll be looking at that. So there's some good stuff coming. I think it'll be interesting. Yeah. She's pretty cute. Hi, sweetie. So, what other questions do you have? We can talk about anything.
I didn't know this clinic this portion was going, so I just hopped in because I actually had a question.
Great.
Just about recommendation for taking a puppy on a flight.
Okay.
Have one tomorrow, and so just reducing stress, whatever.
Sure.
Recommendations.
Sure. So how old is the puppy?
10 and a half weeks.
Okay. Generally at 10 and a half weeks, we'll either use just Adaptil, which is a pheromone.
Yep.
It comes as a collar, it comes as a spray.
Mm-hmm.
Or you can add some gabapentin if you think the puppy is going to be particularly stressed. Now, a lot of our puppies have ridden in the car
Yeah.
dozens of times by the time that they leave our home. So it depends a little bit on their experience. If they have not ridden in the car a lot, or when they have been in the car they've been anxious, whiny, crying, that kind of thing, then I would do gabapentin. And gabapentin is really safe even on really young puppies. So you can administer gabapentin 8 hours before and 2 hours before the trip. And then the puppy's usually a little bit more relaxed, tends to sleep. Now, most of the time when I've flown with puppies, I've flown with puppies multiple times, and I've flown with kittens. I actually brought 2 kittens back from Europe. So we have just put them in the carrier and not had to do anything extra.
Yeah. Of course, the one that I haven't, that I'm shipping, or I'm bringing him, but he's the more voiceful one out of the bunch. I'm like,
then gabapentin might be a good idea, because you want him to be not offensive to other people on the plane.
Right.
It's like that crying baby. When you get on the plane, you look around, you're like, oh no.
He might be fine with me, but I'm just like, of the weather.
I had that kind of fear too, because I did ship a couple of mine, or they came and they were going to be on a plane from Minnesota to New Jersey. I just started practicing. They sent me stuff, so I put the puppy in that carrier it was going to be in. And I just kept doing that and trying to get it acclimated to the carrier. And they said she was amazing.
But tomorrow doesn't give you a lot of time.
No, it doesn't. But I've kennel trained him at night, so he's used to a smaller, space.
You might be surprised.
And it'll be me with him, so
So take a couple extra potty pads. If he gets whiny, do you know this trick to take him into the bathroom on the plane? Have a potty pad in the bottom and take some spare ones. And then if he gets whiny and you think it's because he has to go potty, take him into the restroom with you. Put a potty pad on the floor, straddle him. Because those rooms aren't very big.
I know.
Put him on the floor, let him urinate, or have a stool, whatever he needs to do. Roll it up, put it down the chute, and then go back to your seat. And usually that'll help them to calm down. Because sometimes they're just antsy because they don't want to make a mess in the carrier. Take his favorite toy to sleep with. If you've got a shirt or a towel that mom has been
I have a blanket that he's been sleeping with that I was going to put in there.
Good. Don't wash it. Take it the way it smells. So just make sure that you make him as comfortable as he can be. And then, of course, take a bowl for food and a bowl for water if you need it. Always take some food, because you never know when you're going to get caught in a delay. So take food.
You have to, actually. Excuse me. You have to take food.
Well, it depends on whether they're flying cargo or not. So...
you don't have to take food if you're flying with them?
They don't check you if they're flying on the plane with you. They do check
if
them
you
if
have a
they're flying
layover
cargo.
and something happens or whatever.
If they're flying cargo, they give you a list of things you have to have. And I usually take an extra leash. Just take a few extra things, because you just never know what's going to happen.
For sure.
Take extra potty pads. They're easy to pack. They're lightweight.
For sure.
And most puppies, once they get on the plane, in my experience, the puppies I've flown with have been really good on the plane. I think the hum of the plane, the vibration, all that stuff, they just kind of fall asleep. And they do a pretty good job. But you don't want to be offensive.
I've flown with 3 of them before, and they've all done fine, but I'm just nervous on him, because he's super
generally
noisy.
Dogs do really well.
They do.
Shipping-wise.
And the kittens we took did really well too, but there were 2 of them. And as soon as we got to the airport, they said, put them in the same carrier. We had 2 carriers because that's what they told us we had to have for the airlines, but they had us combine them into one carrier, and they were a lot happier to go
For sure.
than they would have been separately. But take his favorite toy, and take something that smells like him, and potty pads are lightweight. They're easy to take extras of. You can never have too many potty pads. Because you just never know.
And they're easy to take or bring with.
Probably one of those little packages of baby wipes just in case.
I have those. I was going to say, I have a snuggle puppy that he's been sleeping with too, but I don't think he and the snuggle puppy will fit in this carrier underneath, because it's a
Does it have one
plane.
of the heartbeats in the snuggle puppy? Can you take that out? Is it in a pouch?
Oh, yeah, that's a good idea.
Because you might be able to just take that out and put it in the carrier.
Put it in the
potty
blanket
pad.
or whatever. That's
so he can feel it. Even if it's not the puppy itself, that sensation is still there.
For sure. Okay.
That's a really good idea.
If I did the gabapentin, what would the amount be?
Well, the dose is 10 to 20 milligrams per kilogram. So have we seen the puppy here?
Yes.
Okay. So one of the docs can calculate that for you if you want to go back over before you leave today. They can calculate a dose. It comes as a liquid and as a capsule. So if he's too small for 100 milligrams, then we can get you the liquid, and then you can just administer that.
Okay.
So it's an easy way to just keep them quiet and calm. And
Yeah.
I don't think
I was
you.
gonna
I
say,
don't
I haven't
think.
had any
I don't think
issues
you mentioned
before,
that
but-
either. When they ask, don't
Right, yeah.
mention that. My
Right.
dog has had no drugs.
Right, and AVMA used to tell us not to sedate dogs before they traveled because they felt that it was going to make them harder for them to adjust to the surroundings and the temperatures and things like that. But that's before we used some of the better drugs that we're using now, like gabapentin. People used to use acepromazine a lot.
But I think they didn't have them in the heated and air conditioned
Right.
climate, and they
Right.
got down in the
Right, when they were in cargo, it was a whole different thing. But when they're in the seat, it's somewhat different. But acepromazine is not an anti-anxiety drug. Acepromazine basically paralyzes the dog. So all you would do was make them lay flat and be afraid, but unable to move.
And then they would be down there in that cold.
Yeah, it was not a good drug for us to be using. But that's 40 years ago, that's what we had. We didn't have some of these other drugs. So now that we have gabapentin, and it's pretty widely used, it works really nicely on puppies. I wouldn't use trazodone on a baby, but I would use gabapentin. And in fact, sometimes we'll see dogs coming in from the emergency clinic and referral centers if they're really young puppies and they've been injured somehow. The gabapentin is much safer as a pain medication than some of the non-steroidals in very young puppies that don't have full renal and liver development yet. So gabapentin is pretty universally considered to be safe for
I've heard that.
sedation, for pain, for a lot of those things. So I think GABA is a pretty good choice for you. In some states, GABA is a controlled substance. Here in Wisconsin, it's not. And as long as one of my doctors has seen the puppy, then we can get some medication for you.
Okay.
So just pop back over, and
Okay.
Nikki will be at the
It's so
conference.
crazy over there. Oh,
It is a little bit.
It's actually quieted down just
Did
a
it?
little.
Okay.
It's not quite so busy in the front area.
It's supposed to be busy over there.
It's good.
Is it a nutrition thing you got going over there? What?
Oh, okay.
It's
Health
our
clinic.
health clinic. So we have an ophthalmologist, a cardiologist. We're doing hips and elbow x-rays. We're doing DNA testing. We're doing semen collection. So we're doing...
How did we miss information like that?
Yeah, that would have been a good one. We would have been
Where do you live?
It'd be easier to take a plane
Okay.
Caledonia, Illinois.
right by Rockford, Illinois.
Yeah, so usually every fall, this weekend, we do this health clinic. We stopped during COVID because we didn't want to put that many people in a space at the same time. But we have Dr.
Maybe
Callahan.
there's a list or something that we can get on to be notified.
Yeah. So we have Dr. Callahan that does our hearts, Dr. King that does our eyes, and then we do the hips and elbows. We'll do semen collection and freezes. We do DNA tests at reduced prices. So we're pretty, but we do patellas, we do thyroid. So we're doing pretty much the whole, whatever you need to have screened before you do a breeding for your particular breed of dog. We're providing that. So in one-stop shop, you can get it all done instead of having to go see
So nice.
3 different people.
It is very convenient.
Yeah, the ophthalmology. We always used to follow the ophthalmology clinics around.
Yeah.
But you could do everything.
Yeah.
Yeah.
Pretty much, yeah. We have a limit on how many hearts and how many OFAs, hips and elbows we can do based on just our volume, our capacity. But we can do pretty much unlimited eyes, unlimited DNA, thyroid, patellas. So, yeah, we have a system.
We could have double shot today.
Yeah.
Multitask.
There you go. So, yeah, Katie, my repro assistant, has done this. She's got it organized, man.
It actually goes through quite quickly.
Okay.
Yeah, that would be kind of her type of thing.
That's right, you were there. I saw you sitting there.
Yeah, it takes a little bit. So, Tina, you have some questions?
Well, I always have questions until you put me on the spot, and then they go.
Okay. Did you have any other questions?
Same thing. I was gonna ask one other thing, and I'm trying to remember what it was about reading. Let me think.
Let's talk about the stud dog.
Okay. What would you like to talk about?
You talk about all of the stuff that the females need.
Mm-hmm.
Do the boys need anything?
For supplements?
Yeah.
Yeah, absolutely. They should be, of course, on a good quality diet. And stud dogs, after the age of 12, AKC requires a letter from a veterinarian that states that the dog is still fertile. So it's an overage sire letter that we have to send to AKC. So obviously AKC knows that after they get to a certain age that semen quality starts to decline. After age 5 is when it actually starts to diminish. They start to develop thyroid or prostate problems, so semen quality starts to decline at that point because the type of testosterone made in the testicles starts to change. So we start to see benign prostatic hypertrophy, hyperplasia, things along those lines. We'll see testicular tumors. So a lot of things start to change. But a male dog should be on a great quality diet, just like our females should, because really reproduction is a luxury of the body. If you're trying to keep your brain and your heart and your lungs and your liver alive, your reproductive organs aren't your top priority. So if we don't have dogs that are on great nutrition and a good nutritional plane, if they're too heavy, too thin, if they've got any health problems, those are all things that are going to cause a decline in their semen quality. So I think that we need to be on an appropriate diet. Rick Kessler at Royal Canin is now starting to recommend the HT42D diet, which is a pregnancy diet for stud dogs as well, which I think is really interesting because it has some anti-inflammatory effects in the diet without it being a drug.
At what point?
I would say probably if he's starting to have a decline in semen quality, or by the time he's 5, I would probably start considering that. But we know that we get much better outcomes for reproduction when we're feeding Royal Canin and Purina diets. I'm universally going to tell you that if you come in and you say to me, I have poor fertility in my male or my female, the first thing I'm going to ask you is whether you're feeding or what diet you're feeding. And I hear people say all the time, I feed a really great diet. I spend a lot of money on it. Well, that doesn't necessarily mean it's the best diet. It might be at the front of the store when you go into the pet store. It might be the first thing that you see on the Chewy website, but it may not necessarily be the best quality food that you could be feeding. So I'm a huge fan of both the Royal Canin and the Purina diets. So Purina Sport 3020 is my preference, and for my stud dogs and my females, either the HT42D for pregnancy or the mother and baby dog products, because those have the nutritional components that we need. And when you look at the label of a bag of dog food, you can look at it and say, well, it looks the same, it's the same. Well, when you look at it, you see the macronutrients, which are protein, carbohydrates, and fats. Those are easy to analyze when you look at a bag of dog food. You can see what percentage those are, like Purina Sport 3020, that's 30% protein, 20% fat. Easy to see. It's the micronutrients that are much more difficult to assess. Those are going to be things like selenium and vitamins and other minerals, manganese and magnesium and phosphorus and calcium and all these micronutrients that are a lot harder to compare one bag of food to the next when you look at the label. So we have seen huge improvements by just switching to a Purina or a Royal Canin diet. I had one client that came in two or 3 weeks ago with miniature dachshunds, and he said, Dr. Greer, I have to tell you something. I'm like, okay. He said, so when I started coming to you, I just moved here to Wisconsin, and I told you that my litter size was pretty small, and I thought I could do better. He has 10-pound dogs. And he was getting on average of 3 puppies per litter. And he said, the only thing I changed, both for my males and my females, the only thing I changed was dog food. I didn't change any supplements. I didn't change my heartworm and flea and tick meds. I didn't change anything in my environment. I went from what he was feeding, which I will not mention the name of, to Purina Sport 3020, and he went from 3 puppies a litter to 7 puppies a litter, with that as being his only change. And it was the same 3 bitches. So it wasn't as if he switched up the fertility or the dogs in the program. So those girls were all at least a year older and had improved fertility. How much of it was the stud dog, how much of it was the bitch, is hard to analyze, but for sure, there's no question that there's a definite correlation in nutrition. So once we get past just good basic nutrition, I like the ICSB CF+. I think that's a good one. That's a Perna muscle base. They have an advanced formula. I like Be Strong, which is a Revival product. We have at Revival a number of other fertility products. We have In Between for him. We have OxyStud. There's a lot of products on the market. And you can find a lot of products, but it's hard to tell what's in nutritional supplements. Then when we start looking at the semen under the microscope, if we see bent or curled tails, that can sometimes be reflective of some other nutritional issues. So we'll add L-carnitine to the as a supplement, and you can buy that over the counter. It's not a prescription item, and we'll start to see some of those sperm abnormalities straighten out. So, it may be thermal, it may be nutrition, it may be disinfectants in your kennel, but there's definitely some nutritional components to what goes on with male dog fertility.
What does Oxystud do?
It has some anti-inflammatory effects, basically, that just improve semen quality. So we have to have when we look at semen, we look at 4 parameters. We look at morphology, which is the shape of the sperm. We look at motility, which is how it swims. We look at sperm count, so the number of sperm, and then we look at longevity. How long does the semen live once it's put in an extender and we stick it in the fridge and come back 2 and 3 and 4 days later and look at it to see how long it stays alive when you warm it back up. The other parameter that's a little bit harder to measure is the DNA component to it, which is we do with the nucleo counter, and that assesses the semen viability and in another format. So those are the parameters that we look at.
I just have mine collected.
What's that?
I just collected
Oh, okay.
Henry.
Okay, good.
And he had good numbers, they
Good.
said.
Good. So sperm counts should be roughly 10 million per
So
pound
if
of
they
body
want to
weight.
see this,
So he should have 10 million sperm per pound of body weight. So according to this, he should be a 48-pound dog.
okay,
He's what, about 20 pounds?
yeah.
So he's got roughly twice the number of sperm
was
that
that?
you would expect.
We just did our dog here. He's like on the line of that. What was Lenny?
He's around 6 million.
He weighs 14 pounds.
Yeah. So we would expect to see about 140 million. So maybe it was a little bit more than that.
Yeah, it was like way high.
Mhm. So then we look at viability, which is what the nucleo counter can tell us is how much, not just are they swimming, but if they get into the reproductive tract, are they effectively going to fertilize an egg? So viability is really an important parameter. So those are the things that we can really measure. And according to this, he's got 95% motility and 88% viability. He's got great semen, and he's 6. So that's the age at which you can start to see a decline because of the prostate.
And they did check that in this
Good.
time.
And with prostate disease, we'll see it flare up when females are in heat and the dog is around them. Sometimes even just going to a dog show or sharing a hotel room for a weekend with a dog in heat can throw the male's sweet semen quality off because their BPH will flare up and you'll have blood in the ejaculate.
Oh, wow. Okay.
So we see a lot of fertility things that are related to age, related to environment, related to nutrition. So there's not a magic drug that we can put most dogs on. Finasteride does a great job for dogs with BPH, but if you have other issues, we don't have some magic pill that we can just reach for. And it's usually not a bacterial disease. Most people want to just put them on an antibiotic because they know what an antibiotic is and they feel like it's safe. But it's not always safe to just willy-nilly put your dog on antibiotics. So we don't recommend that routinely. And if we do see blood in the ejaculate or blood dripping from the penis in a dog that's over age 5 or a Bernese Mountain Dog that's over age 3, we're going to be looking at BPH as a possible cause. And antibiotics don't fix BPH. A lot of veterinarians will use them because they see blood, they don't know what else to do, so they put them on an antibiotic. But BPH is not going to respond to antibiotics because it's a hormonal disease, not a bacterial disease. So it's important if you do see that blood dripping from the penis or in the ejaculate that you address it with somebody that is versed in canine reproduction and isn't going to just hand you a bottle of pills that's an antibiotic and think that that's going to fix your problem. Does that answer your boy dog question?
Yes.
Yeah. There's a lot of male fertility supplements on the market. It's hard to tell how well they work because it's really difficult to assess. Nobody's really done a study on a large population of dogs and their fertility and nutritional supplements, and we really need that. So we need to find some nice young veterinary student that wants to go into canine reproduction and do some research on it. And AKC actually funds, with the Therio Foundation, they actually fund internships and residencies at some of the veterinary schools. So we have some hope.
So I have a little guy that has like some issues, like when the females go in heat and stuff. So should I just like collect him when the other females go in heat and then
It makes it a lot easier if you are going to collect and freeze when the girl's in heat, because then you bring the girl in and use her as a teaser.
But I mean, I wasn't going to breed him, but he just goes bananas.
I would for practice.
Yeah.
And then
Speaking
would
from
that,
personal experience, my male was like.
for lack of a better term, like relieve some pressure, so to speak, on him? Would it be better on his?
Some dogs are better. Some dogs are actually worse because then they figure out that they.
Mm-hmm.
Yeah. So it depends. If you're never planning to breed him, then you may want to just neuter him.
No, we
You
still
plan to
want to
breed him
breed him,
later.
but he gets
Oh, yeah.
he gets.
Then they're right. Get him used to being handled and
I
collected.
would collect them then.
Because some dogs don't willingly allow us to collect them, and so if he gets familiar with that, it actually helps them quite a bit.
He knows how to. He's been collected.
But it's his I think it's his prostrate. Like when the female's getting heat.
How old is he?
He's a little bit older.
3 or
I was
4,
thinking he should
maybe?
probably come in for an exam.
Yeah.
We've
Yeah.
just been.
It'd be a good idea to have him evaluated. We can check the prostate with a rectal exam. We can do it with ultrasound. It's a good idea to see what the semen quality looks like, because we do see BPH cause a decline in semen quality. So putting them on finasteride can really be helpful in keeping them fertile as they age. Because you don't want him to lose his fertility. We want him still.
Yeah, I'd
able to
actually
breed.
like to lose him, but the last couple of times that we've bred him, use him, not lose him. The word is
That was Freudian.
But he hasn't gotten him pregnant, so I just bypass him and use somebody else. And then I was like, I should probably not do that.
Then we need to figure out why he's
Yeah.
not getting him pregnant.
Because we have from one extreme to the other. We actually had a dog that's going on 13, and he just produced a litter of 7 puppies.
Yeah.
Not even knowing that he needed to be checked, but
Yeah.
obviously he's doing it.
Yeah.
And then we have that other guy that he's frozen here, and we just so I'm not obviously remembering the numbers because they're always kind of impressed is the word of how much he weighs and
What his semen
the
looks
volume, and then it's always the mobility and all those things are very
Right.
good. But then we have this guy that we've just been kind of bypassing so we should really probably get
Yeah.
him checked.
Yeah.
Because then maybe he just needs to be neutered then, or
Yeah, either we can make him better or not, and if he's
Right.
not something we can
so then
correct,
why
then
frustrate him because he
Exactly.
is pretty.
exactly. Unless there's some reason to keep him intact for show reasons or
No, we're not showing.
something else. So yeah. So neutering him might be the best solution. And
We're
again,
saving some of that spread.
and
He's
again,
our most
people want to
expensive
use,
dog.
Of course he is.
Oh, totally. We
But-
tested so many litters with a breeder for like 6 months, and then he got hit by something and $5,000 later on his leg. And
6,700, but who's counting?
Yeah. Nobody.
and his temperament's not so great, but
He has a great
babies-
temperament.
His babies are the best babies in the whole wide world. But whatever. Anyway, he barks. Doesn't matter.
He
He's got
barks
the
a
idea.
little.
Yeah. Yeah. So it's worth checking out to see if there's something you can do to improve his semen quality, and if not,
Yeah,
cut your losses.
absolutely.
We used to use acepromazine for that too, but ACE doesn't really, like I said, reduce anxiety. It just paralyzes him.
Every day
So-
we'd have to give him it. He'd be permanently drugged.
He's one of those. Oh, yeah.
Yes.
Yeah, there are dogs like that. Yeah.
It's interesting how certain drugs are interchangeable amongst animals, like horses and
Yeah.
dogs.
Oh, they're all the same. I learned that when I worked at a horse farm.
I just was like,
When
okay.
the color of, and I worked in a doctor's office many years ago. It's the same drug, just the people's is shinier and more money. That's what I learned a long
A
time
lot of
ago.
it is very much the same.
Yeah, I don't know about all of it, but
I mean,
a lot.
We had one girl who was going into pre-labor before she was due by 5 or so days, and ended up putting her on Regimate, and that's
Did they
for
win
the
it?
horses.
Right.
I mean, that's for the horses.
It is, yes.
And it was like, oh crap! And so we just called up the horse vet because you guys were closed when I got the report back on her progesterone level. And we called the horse vet, and she goes, "Sure, I'll write you a script
For regiment.
For the dog, too?
for the dog."
Right.
Yeah.
And so then it's like, well, we'll need it anyway for one of the horses at some point. So
Right. Now there's a lot of overlap, a lot of interchange, which is great. we can use all that information. One of my favorite things is that when we're looking at what's safe to use in a female that's nursing puppies or a female that's pregnant, we can use the data from the human side. Because the Harriet Lane Handbook, which is given to every medical student on the planet, well, at least in the U.S., has a list of all the drugs that are safe during pregnancy and during lactation. It's all been tried on humans. I'm like, that's great. We have humans as guinea pigs instead of guinea pigs as guinea pigs. Right. So, yeah, there's a lot of information that's out there. There's a lot of similarities in what's safe and what isn't safe and what we can use and drug doses and all that.
I got a question about like drugs that they say you can give that don't go through to the puppies, or like they don't go to the milk and then to the puppies. Is there really such a thing as it doesn't go through? Yeah. There are some drugs that just don't end up with much in the milk, or if it is in the milk, that it doesn't cause any kind of an issue. For instance, an antibiotic, you can't get enough antibiotic if you give the mother antibiotics. That's not enough antibiotic to make a sick puppy well again. So yes, some of it goes through, but not enough to cause an issue or to be concerned about. So it depends on the drug, and we do have pretty good lists of those drugs. Like I said, we use the Harriet Lane Handbook. We've got published lists on the veterinary side, so we just rely on the information that's been gathered, so we know what's safe and what isn't safe. So like most everything is going to go through. It's just a question of its safety and how much goes through. Exactly. Is it going to hurt the puppy to have amoxicillin in the milk? And the answer is no. Yeah, because I was a believer when my little daughter she would eat green beans and my baby would poop green. I was like, everything goes through. Yeah, we had trouble with broccoli. My son would get a bellyache. Gassy, that's pretty normal, yeah. So, yes, but it was a good thing that he didn't have an intolerance for chocolate, because he would have been mean. You're like, sorry, dude. If you can't do chocolate, you're done. So, yes, there's definitely, everything does go through the milk. And if you think about it, I mean, is it water soluble? Is it fat soluble? It's got to be one of the two. And there's both in milk, so, yeah. So it's probably going to end up there. To a certain point. Yeah, it depends on how it's cleared. Some like drugs. Some drugs are cleared by the kidneys. Some are cleared through the liver. Some are cleared through the intestinal tract. They're not cleared at all. They just go out. So it really depends on the drug. And we have a lot of information on it. So it's good. So I'm sure you all have the same problem. Maybe you don't. Maybe it's just me. It's probably just me. Probably not. Getting your girls to eat when they're pregnant. Oh, yeah. Oh, not mine. Really common. I'm so sorry. I wasn't planning on coming to this, but I really appreciate the information, and I have another appointment I have to get to, but it's really nice. Good luck shipping. Thank you so much. Shipping is a breeze. He'll be fine, I'm sure. I'm just overthinking it. Yep. Appreciate it. Sure. Bye. So, it's pretty common for females not to eat well. What breed? Jack Russell. I mean, we used to breed Jack Russells. So the list of problems with Jack Russells is... This is her first litter. And literally probably a week and a half, 2 weeks into the pregnancy, could not get her to eat. Cans of tuna fish. No. Tuna didn't work. Emu didn't work. Kangaroo didn't work. Bison kangaroo didn't work. Wow. Gave her ostrich. That didn't work. We did hamburger. We did... she's a lot more exotic than I am. What is the... I even tried the moose. I get the squirt bottle from... Revival. That fortified, isn't it? Fortical. Fortical. Is that the correct term? That really gets... And it's a soybean... What's the sweet part in it? I think it's probably molasses. I don't know the label. And generally that tricks them into it. Try that. I squirt it like on a everything, not just dog food. I'll like take tuna fish, dog food. We call it plates. Call it a plate and squirt it and mix that all in. She wouldn't even eat the tuna. She wouldn't do salmon. I cooked her salmon. And then I was like, I'm going to get her hot dogs because you train with hot dogs. Well, then I find out hot dogs are not good for them.
At least it's food.
Right. If it, I mean, it's
She
like kids.
ate 2 hot dogs and 6 hot dogs in 2 days.
Yeah.
It was
Because she
6
thinks
hot
of your
dogs.
McDonald's diet and your
Food is better than no food.
Right. She's got to eat something. I agree.
Right.
And so, is that okay? I mean, I've gotten her reduced down.
Sure.
I figured, okay, I'm going to cook a pheasant. I cooked her a pheasant.
we should go to her house.
I know, that's what I'm thinking too.
I cooked her a pheasant with chicken broth, and then I took the broth from the crock pot the pheasant was in, and I made her rice.
That
Oh
yeah.
yeah.
She's got you
that.
trained.
Yeah.
Jack Russell.
Jack Russell's trained you.
That they
Yeah.
do.
So I got her now sort of eating, and then one day, it was a week ago Friday, she came down and she licked the bowl of the puppy kibble, the Purina or the Royal Canin puppy kibble. Even though I've tried all of these, and she's like, no, she wouldn't even touch the mousse, and she wouldn't touch any canned food. I was like, I'm gonna try some Royal Canin puppy food, and she scarfed down a half a cup of food, and I'm like, oh my god!
You probably hit it on the day that she was going to eat.
Right. And then
Yeah, exactly.
I've went through some. There's periods where I assume just morning sickness,
Yes.
more or less, and
Yeah.
they'll
Now
go.
this is 6 weeks.
Oh wow, no, 2-3
So-
days.
We see consistently between the 3rd and 5th week of pregnancy, that's a very consistent sign of pregnancy. It's probably the most consistent sign that you can see other than ultrasound. So it's very common, and yes, there's probably a component of morning sickness to that. And then we see it again just before they whelp. You know, a day or so before they whelp, they'll drop off and maybe won't eat very well during whelping and for a day or two after, because they're so devoted to those puppies they don't want to leave long enough to eat anything or drink anything. And then they start to take off again. In my experience, the bigger the litter, the more likely they are not to eat well.
Oh, really?
Yeah, which of course is contrary to what they actually need, because the bigger the litter, the more calories they should need to take in.
Right.
So it can be
And
really
that's-
frustrating.
Why I'm frustrated and I'm like so concerned, because as you know my history, I'm like, I'm gonna have these puny little puppies that, are they even gonna make it?
But-
I mean, she is getting bigger.
Right, but remarkably, somehow those females gain weight even though they're not eating, because metabolically they do change. So once they get to the pregnant state, like I said at the beginning, pregnancy is a luxury of the body, so they may not get pregnant if they're not nourished well. But once they get to that point, then their body depletes all kinds of other sources to feed the puppies. We've had clients not be aware that their female is pregnant, and they will keep cutting back on the food and cutting back on the food and cutting back, because they're like looking at the dog going, why are you so fat?
We've almost done that.
And then they realize,
Sometimes.
oh thdear, I was
I thought
not
she was
eating.
fat.
Yeah, so we can see that. But there's a lot of bitches that just don't eat well between the 3rd and 5th week, and then around the time of whelping. So around the 3rd to 5th week, you can give Pepsid, famotidine, and that is safe and it can be helpful. And there probably is a certain amount of gastrin changes, the amount of gastrin made in the stomach, that affects the appetite. And then toward the end, they have to eat smaller, more frequent meals, because their uterus is expanded to the point that the stomach is being squished, the intestinal tract is being squished, everything is kind of being compressed by the uterus, so then their appetite will drop off, and then when they go into labor, of course, they're focused on other things. And that's where I pull out the ice cream for labor, because there's not enough calcium in ice cream to really make a difference in labor, contractions, and contractility. But it gives them some fluid, it gives them some energy, and those females often haven't eaten for 24 hours, and then they're working pretty hard to have that litter. So I'll pull out the ice cream and help the bitches out with that. And I've had a lot of females that won't eat anything else, but you put a scoop of ice cream in front of them and they'll go for it. So it's a scoop of ice cream, have a puppy. Scoop of ice cream, have a puppy.
Do you
Yeah,
still use
safe.
the gel?
The calcium gel, yeah. Because there's not enough calcium in the ice cream. You may convince yourself when you're eating a bowl of ice cream every night that it's because there's calcium in it. It's
I
good for
did
you.
convince myself one thing about ice cream about 10 years ago, that I get fat from ice cream now.
Yes, that's easy to do. Yeah.
Mhm.
So there's not enough calcium to justify the calories, but it does taste pretty good. So yeah, the calcium gel or the injectable calcium are still really useful during labor, because you're just not going to get enough calcium from the ice cream itself, or yogurt, or cottage cheese, or anything else. And if a female's not going to eat well, for most things, if she's going to take anything during labor, it's probably going to be ice cream, because it just
But that's a good way to sneak in more liquid than anything.
Right, right. It tastes sweet. It's fluid. It's fat. It's calories. It's fluid. So a lot of females will do really well with calcium or with ice cream during
that was the first time when she was talking about this. Is just very recently. She says, "Oh, I always give them ice cream," and all I could picture was Gabby sitting there going, "Yep, we'll pull a little bit for you."
Yeah. No, you can have Rocky Road. You can have Bear Tracks. I don't care what kind of ice cream you eat, but the dog should have vanilla.
Right.
So I mean, we're 2 weeks
Pregnant.
From her due date.
Okay.
Oh, so she stopped eating at the end of her pregnancy?
No,
At the beginning.
At the beginning.
Oh, okay.
She was a week and a half in. Yeah.
Okay.
A week and a half too.
Yeah.
And right now I'm like, a week ago Friday I got her to eat a whole cup of kibble,
And
I felt that
dance.
I did.
I know. It's like, this is ridiculous. 1 cup of kibble. I'm this excited about it.
Because that was like the most that we were able to get into her.
Yeah.
She really liked the pheasant though.
Well,
You're
did you
saving
repeat the pheasant?
I have not, because she started eating the kibble.
Yeah, but you can pull that out of your freezer again if you need to.
Yeah. I mean, I just let it cook all day, and I was like, somebody had said, feed her rice, but don't cook it in just water.
Right.
Yeah.
Flavor it.
And the rice seemed to be like, she really liked the rice and pasta.
Mm-hmm.
Another Jack breeder who bought her girl from a vet, he said, feed them pasta. It's good in niacin and thiamine.
Mm-hmm.
Your saving graces is that they're Jack Russells, and
They're so resilient.
I don't know how. There's probably hardier breeds, but I don't.
Not that
I
many.
can't roll them
They
off
are-
the tip of my tongue.
They are pretty hardy.
Mhm.
Yeah. Kraft macaroni and cheese. A lot of dogs will eat that. And I'll have people that come in and say, "Oh, I can't get any weight on my dog." I'm like, "Kraft mac and cheese." They go, "Oh, does that work?" Works for me, right? Yeah.
We can share
Puts
that
weight
way.
right on me.
So,
yes.
I've gotten her as long as so it's not going to be that terrible that it's going to, the hot dogs.
No, hot dogs. I would not worry about hot dogs. I'd rather have her eat hot dogs than nothing. So sometimes you just open the fridge and say, okay, there's a smorgasbord here. What do you feel like today? And that's the really discouraging part, is you find something that they eat and you're like, yes, we've got it. And then the next meal they look at you like, nah, just kidding. But it's not
that's
food aversion.
basically what she has done.
But
to
it is
us.
a food aversion thing, and a lot of dogs will develop food aversions. Cats will, just like people do. If a kid goes to a birthday party and eats 12 hot dogs and then gets sick, they may never want to see another hot dog in their life. So you can develop those food aversions. So you want to try to be aware of that. So that's where Pepsid can sometimes be helpful during the pregnancy. And then for lactation, we've all talked about lactation, because they've got to eat and drink 2 to 4 times their normal amount to adequately lactate. I have a litter of 7 puppies right now out of a 20-pound bitch. Yeah, that's a lot of puppy for a little 20-pound dog to have.
What do you have?
I have Danish Swedish farm
They
dogs.
look like Jack Russells.
Yeah, they look like a Jack Russell.
I've seen them.
Yeah, but I use vegetables, I use oatmeal, and I use bratwurst, and all those. So the root vegetables like sweet potatoes and oatmeal are recommended by lactation nurses on the human side, and then we see for some reason bratwurst helps to bring in the milk, and I don't really have a good explanation for it because there's no fenugreek in the brat formula, the brat mix, seasoning mix. But for some reason, I don't know if it's the salt, I don't know if it's the fat, I don't know what component of the bratwurst helps to bring in milk. But hey, I'm going to go for it. If it helps the females to lactate better, then by all means I'm going to.
Did you also not say stale like beer?
Well, on rare occasion I will pull out a beer. Mostly I'll do that
Because it's usually wine, right?
No, bourbon. No, you don't want to do that for your dog. So light beer I will use rarely on a dog that is maybe anxious or not drinking or eating well. It has to be flat. They don't like the carbonation. Most dogs don't like carbonation. My current Danish Swedish farm dog puppy, likes beer, unfortunately. If I turn my back on a glass of beer, I come back and I'm like, woo, I don't think I had that much going. But so some dogs don't like the carbonation. So on rare occasion I would pull out a light beer. please do light beer. Don't do 12% alcohol beer.
But
She'll lay on a puppy.
They used to say that about women.
Yeah,
to
absolutely.
have a beer a day. And,
Absolutely.
Yeah.
To help bring in the milk. So, and sometimes it helps if the bitch is anxious, not laying down, not really too crazy about her puppies. You can use Adaptil, you can use calcium, you can use placental fluid if it's been saved from a C-section or from placentas that have been delivered. But if all else fails, I'll pull out. I mean, this is Wisconsin, right? We use a lot of beer here in Wisconsin for a lot of things. But I would not recommend bourbon or wine for the dogs. It's a little much. So, yeah, and I like the light beer because the percentage of alcohol is lower.
It took about 5 days for Feather's milk to come in.
And sometimes it does. Sometimes it takes 3 days for them to decide they want to be a mom. Sometimes it takes 4 or 5 days for the milk to come in. And that's with Oxymama, with fenugreek in it. That's with Regimate. We were talking about domperidone yesterday. I personally have not had good outcomes from domperidone. It's an equine drug, a horse drug. I personally have not had good outcomes. I've tried it. My corgis don't feel good on it. The bulldogs salivate heavily, and the last thing you need is for a bulldog to salivate more than they already do, because they already can't breathe, so let's not make them any more difficult.
Yeah, right.
So I personally have not had good outcomes from domperidone, but there are some veterinary clinics that do, and it's not the champagne, it's a drug. So just depending on what your experience is and who you're working with, those are all things that we
Seems like the fenugreek tends to work for her the best.
Yeah, and I try to get just straight fenugreek or the Oxymama because I know that those are safe. When you go to the store and you buy the fenugreek supplements for people, there's a lot of other stuff in those. I've looked at the label and I'm not comfortable with some of the things that are in there because we don't really know if they're safe in dogs. Just because it's natural, just because it's at the health food store, just because it's okay for a person to take, doesn't mean it's safe for a dog. So I'm pretty careful not to give some of those other supplements. We know Oxymama is safe. And it's really, the bitches really like it. They'll take a handful of it.
I wouldn't touch them this go around.
That's unusual because my dogs will, if I opened the bottle and dumped it out, they'd probably eat the whole bottle. I would not recommend that.
No, but she won't, and Anna's the other one that won't. But the other older girls that are off the breeding, they loved them.
Yeah.
It's like,
yeah, it's molasses flavored. It smells good.
I know, I want to eat it.
But I wouldn't recommend it, but it probably wouldn't hurt you.
Smells good.
It does smell good. I'm not really sure why some dogs won't, but
I have
Do
tried.
you use non-alcoholic beer?
I have not tried that, but it'd be a good alternative. And there's some new non-alcoholic
There is some
beers on the
alcohol
market.
in it, not a
Yeah,
lot though.
but it's a tiny percentage.
Yeah.
And there are some newer ones on the market. I'm trying to think what I saw the other day that surprised me. Was it a Guinness non-alcoholic? I think it was. Like, oh.
What's the point?
Well,
You surprisingly enough, I sell a lot of it.
Yeah, but I get it all duels, but like a Guinness non-alcoholic, what's the point?
kind of does seem sad, doesn't it?
Yeah.
Yeah, but I have also not had Guinness at the Guinness factory, and I hear it's a whole different experience when you drink Guinness in Ireland and when you drink Guinness.
Oh
in
yeah, the
US.
Guinness back here is horrible.
Yeah, once you've experienced it, yes. Yeah, but that's that way with a lot of things.
Yeah. My
So.
brother's been to Germany. He says the beer here is nothing like in Germany.
You know, we've been to France, we've been to Belgium, we do beer tours. Yeah, it's a whole different experience. So bringing home a bottle of it isn't the same as drinking it
No.
right out of the tap. So, sadly, yeah. So those are the experiences that we've had, and then the calcium gel, that can sometimes help with bitches that aren't being great mothers. We know in American or in bull terriers that they respond better to calcium, and I think it probably happens in other breeds as well. The bitches that aren't great moms, that are aggressive toward their puppies or aggressive toward people, that can be a calcium problem. And so by supplementing calcium in the gel form, that's the one that acts the most quickly. Well, injectable is the fastest, but orally the gel is faster than the powder or the tablets or the stuff you buy for people. So the gel that we have at Revival does a really good job, and it's really palatable. CalSorb is not nearly as palatable as the Oral Cal Plus that Revival has. One of my own dogs found the empty tube in the trash and carried it onto the bed and was chewing on the end of the tube. So pretty sure it tasted good because if you've ever tried CalSorb, It isn't. It's got an astringent kind of effect in your mouth.
How
But
often
the-
do you think you have to use calcium? I see it all the time that people go, push calcium after like they give birth to the first puppy.
It depends. If she's clicking along and delivering puppies effectively and quickly, I don't think you really need it. But if you have a bitch that has slow labor, I think calcium before you give oxytocin or as an alternative, oxytocin is a good choice. Because oxytocin is not without its risks. You know, you can overdose oxytocin pretty easily and you can have the puppies shrink wrapped, you can rupture the uterus. I've personally never ruptured a uterus and I would like to keep it that way. I've been doing this 41 years and I'd like to retire without ever having that on my resume.
Well, I would like to I know I'm an adult, but I would prefer that they have a C-section and then I get the puppies when they're like 2 weeks old and up.
There is a lot to be said for just coming in when they're 2 weeks old. Their eyes are open, they're walking around, they're ready to start eating, using a litter box. Yeah, it's all good. That whole first 2 weeks makes a lot of people really nervous.
Yeah.
Yeah, because they seem very fragile and really delicate at that age. And then their eyes open, little eyes pop open, and you're like, oh, this is much better. Yeah, they can't see very well the first couple of days, but at least you feel like you're kind of over that first.
Yeah, you're
hurdle.
over like the first hump, right?
Yeah. Yeah,
Okay.
of all the things that can go wrong, they usually go wrong in the first 2 weeks. Yeah.
We made it through ours.
That's good.
You're crazy enough to want to do it again.
Yeah. Dr. Miller, who's the ophthalmologist, one of the ophthalmologists down at the vet school, said there must be amnesia that goes with having children. And I think the same with having puppies. Because otherwise, why would you do it again? Because it's so stressful for some people. Other people, other breeds, other dogs, they just have them. My farm dogs, oh my gosh, they're so easy. Like, they just have their puppies. They just lay down and they have their puppies. And then they're fine. But then we have corgis, and it doesn't go that way with corgis. So different breeds are different.
I'm sure mine would have been easy, but I was too nervous.
You had too much at stake.
And I want to do it again. And
See,
she's
there's
7 going on
amnesia.
8.
There's amnesia there.
It only took 4 years
Because you forgot how hard it was.
to get her pregnant.
Yeah, or how hard it was to raise them or whatever. So then
Raising
you
her
wanted to do
wasn't
it again.
bad. Trying to get her pregnant was impossible.
Yes. Yeah, she was
What
a
kind of
challenge.
dog is it?
Norwegian outcome.
Is that common for that breed?
No.
There's special categories for special patients in every category.
You'd think they'd be like that farm dog. I don't know. That breed would be all by itself out
That
in
it
the
would
barn
be,
doing it.
yeah.
Just,
Like a Malamute.
Yeah,
Just
right,
whelp out
right.
in a snowbank, you'll be fine.
Exactly.
Yeah.
They'd be
Think
happy.
that. Right. Yeah, exactly.
Yeah, that's the
Right.
Nancy Russell theory of raising dogs. If a Malamute can't have her puppies and raise them and keep them warm by herself, she shouldn't have been bred. So yeah, and the farm dogs. I mean,
Right. I
my
was
farm
gonna
dogs have
say-
been great.
I was going to say that's a breeder process of elimination, or you know what I mean, like the
Yes.
I'm still not
strong-
thinking of the right word.
The strong
but you know,
survive.
Exactly.
Right.
Yes, how the gene pool is managed.
Correct. There you go.
Yeah, there's some
You know,
people that shouldn't be in our
Well,
gene pool either, but
yeah,
that's
But our
Yeah.
gene pool is very small.
You got to
Yes,
factor
yours
into
is.
that, that some owners just are overly worrisome.
I was.
Really?
Okay.
I think dogs feed off that. If you have a
They
nervous
can.
person in the room when the dog's
I
having
used
babies,
to be. I really
there's a lot of
was.
finger pointing going on here.
Right, yeah, I know.
I'm
better
feeling it
now.
right here.
and it took me a while to figure that out. It was like,
I told another
It's
friend
you.
that she said that. I said, you just have to kind of walk away, supervise it like at a distance, watch, give the calcium, do all those things, but don't pull them out, don't do all that
Stay out
stuff,
of the
because
way.
then they're going to rely on it. At some point, you're going to sleep through it. They're going to have it when you're, you know what I mean, and then they're going to deliver them and look at them like, where is she?
Yeah.
So
This was her idea.
exactly, this is her idea.
How did this happen? I'm not responsible for this decision.
Right.
So, yeah, you
but
do have to
it was my learning curve. I'll have to.
Well, and there is.
I'm
a
almost
way
to the other extreme. Quite frankly.
Well,
How
At
long
this
does
point,
that take?
a while. But really, it's like, yeah.
But see, that's the extremes I'm at. Is my corgis?
Yeah.
They just rarely do well on their own. The puppies aren't easy to deliver, but they have 14-ounce puppies. Why would a 22-pound dog have a
They
14-ounce
have
puppy?
14-ounce puppies.
Uh huh. Yeah.
They're a
Whose idea
big
was
dog
that?
in a little tiny
You
body.
would get,
actually.
that would be like with the little French bulldog, like the one when it was here.
Right.
Don't they do that?
Yeah, they have pretty good sized puppies. So we've
Yeah.
bred these dogs to have more bone,
Oh, yeah.
prettier heads, bigger fronts, they're angulated in the front now. If you look back at the corgi pictures from the 1960s, they look like a terrier. Their ears were above their elbows, which were above their feet. They were straight in the front. They were narrow. They were built entirely differently. Now we have these little pelvises and these big dogs, big fronted dogs with lots of bone. They can't. We have created this.
Yeah, we have.
It's not just a bulldog thing. We've
Right.
created some
It's
of
all
these
breeds.
things.
If you look at that, I like that when they show the breeds from, like you were saying, 60 years ago or whatever. Every single breed, the German Shepherd,
Right.
everything. It just keeps going
Right.
and going and going.
Right. For little is good, more is better. And so
Yeah.
we've kind of bred to extremes in a lot of breeds.
Right.
But then you go back to the Danish Swedish farm dog, and it's still pretty much a farm dog.
Right,
It's-
right. Isn't that kind of like the Dandy Dinmont, where they had to go back to Dandy Dinmont and get more Dandy Dinmonts from the farm? They really did, because
Yeah.
they ran out of the gene pool,
Right.
and then they.
Basenjis, there's been some breeds that they've gone back to the source and have had to do those things
Right.
to kind of reinvent the breed. Yeah. So that's one of the things that we'll get off on a tangent here, and that the AKC is now working on, is a semen preservation bank. Do y'all know about this?
Yep.
I do, and
Yeah.
I really wish my breed would do that. I'm
Yeah.
not part of AKC.
We're working on that.
When I was with the
You
Jack
gave us
Russells,
your-
I was
Jack
with the-
Russells are part of AKC now.
But I was with JRTCA, and it's not
depends.
that I wouldn't do one or the other. At the time when we were in Jack Russell's, it was just JRTCA, and they weren't in AKC at that
But
time.
you can't cross over into AKC if you're JRTCA.
Are you
Vice versa.
JRTCA?
Yes, I am.
Yeah, I was.
Well, you probably could if you didn't tell them.
Well, no, you can't. I don't think that the.
I think they know.
Yeah,
You
it
guys
is
have
now.
open stud books?
I don't know that terminology.
What was your question?
Do you have open stud books?
I don't know. I don't breed them anymore, but I don't know if they have open stud. Do they have open stud books? That means you can go back to something.
Back to
Fox Terrier.
No, you have to breed to another Jack.
What else? What makes up a Jack Russell? Fox Terrier.
Well, yeah,
I don't know.
Jacks are like a mix of a bunch of
Well,
terriers.
everything is.
right.
All breeds are basically.
Yeah.
I mean,
Nobody-
really, I'm not trying to.
Yeah, 5,000 years ago there was no purebred dog.
So no, the answer is no.
Okay.
We have to breed to another JRTCA dog
Okay.
for you.
That open stud book. What is that lady's name? Her Joanne or something. She was in a seminar. She was a She was a golden retriever breeder. She was a judge, but she's talked to us as a scientist. She was also a scientist, and she talked about open stud books because of the Dalmatian. Because the Dalmatian had so many. What was it? The liver problems. They opened it up
Bladder
back to the
stones.
pointers.
They have bladder stones.
Right, then they opened it up. They went back to a pointer. They opened up the stud book for a short period of time, opened it up to the pointer, but the spots weren't exactly what they wanted. But it fixed the problems because they did the tracing back to the main stud. And he's the one that... Is it liver problems, or you keep saying
It's
bladder?
bladder stone.
It's bladder
Yeah.
stone. Do you know what I'm talking about?
Mhm.
Yeah, but they did have liver problems, and then they
I thought
suffer
liver
from
was
deafness also.
Right. But
Well,
the
I'm sure-
deafness goes with the white coat.
Oh, well, that I did
What
not
goes
know.
with
Yeah.
white coat?
Deafness.
Deafness. That's it.
Oh,
A lot of
we don't
right.
have colors
Says
in our
the white
white
guy.
coat.
What was that again?
I'm getting. I'm getting worse.
Yeah, so white-coated cats and dogs
Right.
there's an increased likelihood that they'll have deafness. So they're born with the ability to hear, but around the 4th or 5th week of age, the cilia in the ear hearing apparatus diminishes and then
Really?
become deaf.
Oh, wow.
Yeah, so when there's bear testing, BAER,
Yeah.
bear
Yep.
testing to check for deafness. So, for instance, my farm dogs get tested because they are required to be at least 50% white. So they're all hearing tested. Nobody in Sweden can tell me if there's any deaf ones. And the problem is with unilateral deafness, you can't tell because they can hear, but you can't really tell by looking at them, by watching how they behave,
Right.
if they're deaf or not. So they have to be bear tested. So I've been bear testing all of mine.
I did bear testing when we were in the Jack Russells, but
Yes.
we're
Yeah.
not no longer with a.
And I have to get one in for bear testing.
Right. So
Which
we
I
have,
wish we had that today.
yeah. So Dr. Zella doesn't do our health clinics. So he'll do it separately. There's too much chaos to do bear testing.
Okay.
It has to be
quiet. Or,
Yeah.
that makes sense.
Yeah, so we do the bear testing here. Dr. Zella has been trained on bear testing by George Strain down at Louisiana. So I did my first litter hearing testing at the vet school in Madison, and I'm like, not doing that again. I'm going to have Dr. Zella tested. Learn to do testing because he has a master's degree in audiology, I don't know, some kind of brain function in audiology. So I sent him in for training. So he does our bear testing. So it's really pretty great if you have white dogs.
Mm.
If you don't have white dogs, then you don't have to worry about
No
it.
beer testing for us.
No, you've got enough.
If we have
They
white
don't
dogs,
come
we
any
don't
other
breed
color.
them.
Yeah,
If we have white dogs, we don't breed them anymore.
I would hope not. Yeah, then we call them Samoyeds.
Yeah.
Yes. And we happen to have somebody who has one of each, and I like, every time they bring the Samoyed to the show, I'm like, that's not to breed standard.
Yeah, for sure. For sure.
It is what it is. Eyes. I have a question.
Yes.
So, Lucy has a cataract, suspected inherited.
Okay.
Now, fuchsia puppy, also known as Callie, got the Y opacities.
Okay.
Are they connected?
They can be, because the Y opacities are on the lines in the lens where cataracts can develop. So it can be related, the suture lines.
Yes.
Mhm.
Is it worse or better if I'm looking at breeding the pup?
Cataracts are worse than Y suture lines.
Okay, so will Y suture lines become cataracts?
Probably not, but I would definitely talk to an ophthalmologist or go into the ophthalmologist book that's online and take a look and see.
I
what they
was
say.
looking at it today while we went for a quick lunch, and I'm still unsure, so that's why I thought I'd ask you
Yeah,
to see if I'm getting any better,
yeah.
or
Yeah,
if
I
I
would-
just kick them both out of the gene pool.
I would speak to Dr. King that did your eye exam
Okay.
and ask him.
Because both boys are fine.
Yeah.
It's got to follow the X chromosome then.
Not necessarily, it may just be random. Because I don't think cataracts have a genetic link. There are definitely some diseases that are sex linked, but I don't believe cataracts has been shown to be that.
Okay.
So I think it's more coincidental than anything. But I would check with an ophthalmologist or talk to somebody at the
He said it comes with a breeder thing, but I'm also going to run it past
breeder
my
option.
crew,
Yeah.
see what they all think.
So I have a friend who has a Airedale, and the Airedale ended up acquiring Lyme's disease. They treated the Airedale, and then they noticed some other things going on vision-wise, since we're on the topic of vision, and noticed that she had a cataract. So the vet is thinking that the Lyme's disease and the cataract are connected because it wasn't there prior to the Lyme's disease.
I have not seen anything published that Lyme disease has correlation with cataracts. If you listen to Jean Dodds, she says don't believe in coincidences. So I guess I would want to know if anybody else has seen it, if any
It's very
correlation has
small.
happened.
Apparently.
Mhm.
And this vet said that because the dog had been going in weekly, she knows it's there, so she would never pass the dog for a breeding dog because of that.
Mhm.
But she said she's wondering if maybe another ophthalmologist would be able to detect it.
Mhm. Interesting. Yeah, and there's definitely eye diseases that develop in older dogs.
This is like a year, maybe
Mhm.
2.
Yeah. So is it a juvenile cataract, or is it related to being sick, running a fever? You know, some of the things that go with Lyme disease. I have never seen a correlation with Lyme disease and eye disease. We know it causes kidney problems. We know it can cause other issues, but I've never seen it with the eyes.
So, and she is considering breeding, and she asked me my opinion. Would you go and do a surf test, since it's something not required for her breed,
Mhm.
and be transparent or not? And I said, absolutely be transparent.
Absolutely.
I said, because when you're not transparent, that's when something's going to come back.
Mm-hmm. Guaranteed. It'll get you.
I said, I do the surf test even though you're not required to for your breed.
Interesting. Surfs are required for my breed. Did you read the new article that is out on the ACL injuries? And they're trying to find the chromosome where it is. Popped up on my feed last night.
I know they've been looking at it in Labradors at the vet school in Madison.
Yes.
I haven't seen the final outcome on that, but
It's a fascinating paper.
yeah, I think there's probably a genetic correlation there. I think there's going to be, in the long run, 20 years from now, I think there's going to be things that we thought weren't genetic that it turned out to be. And I think two good examples of it are parvovirus, because we see a higher incidence of parvo in certain breeds. So anytime you say we see more of this in this breed than another breed, there's a genetic
like strangles. Because I came to you with strangles, and you're like, if you had golden, we'd discuss this, but there's no chance.
No. Right. And so there's definitely, like strangles, like parvo, we see more parvo in pit bull terriers, Dobermans, and Rottweilers than we do in other breeds.
The Mastiff types.
Mm-hmm.
I wonder
Right.
why.
It's something about the way their immune system responds to the vaccine. Then we see more pyometras in certain breeds. If you look at Bernese Mountain Dogs, 48% of Bernese Mountain Dogs end up with a pyometra if they're not spayed. The average is 25% in female dogs over the age of 9. So if you look, there was an article published in Sweden in 2012 in the International Symposium for Canine and Feline Reproduction, presented in Whistler, Canada, that showed breed correlation with pyometras, mammary tumors, and pyometra and mammary tumor in the same dog. So Bernese Mountain Dogs, 48% of them have pyo. In the top 5, well, actually in the top 10, they're almost all the giant Mastiff type dogs, the K-Sound being the exception to that. So we see Rottweilers, Bernese Mountain Dogs, Leonbergers, Great Danes, those all have a higher incidence of pyometra. Well, everybody thinks pyometra is either a hormonal disease or a bacterial disease superimposed on a hormonal disease. But if there's a correlation, then we know there's something else going on.
And then a K-Sound.
Yeah. The K-Sound got thrown in there somehow. A Spitz breed was somehow in the top 10. Now, this was data out of Sweden, so they're going to have a different population of dogs. They're going to have different genetics than we have in the U.S., but all the data in the U.S. that we have that we can glean is coming from Banfield, because they have the biggest numbers of data, and everything in Banfield is spayed, so we can't really use any of their information for assessing pyometras and mammary tumors. But anytime you look at that, we know Bernese Mountain Dogs have cystic endometrial hyperplasia that starts when they're pretty young, which predisposes the uterus to pyometra. So there's a genetic component to that. So anytime you say this is an infectious disease, but we see more of it in a certain breed, you've got to look at the genetic basis for that as well. And so that's where I think it's going to be interesting, is what are people putting in their contracts, what's happening 10 years from now, 20 years from now, when we have more DNA tests, when we have more information. So when you write your puppy contract, you have to be careful what you say you're going to guarantee against. Because are you going to guarantee against pyometra? Who would, right? Who would think that that was a genetic disease?
Right.
Well, it's going to turn out to be, if you write into your contract any genetic disease will cover, you're going to end up covering things that 10 and 20 years from now you had no idea were genetic. So those are some interesting things to step back and take a look at. So it's not just about eyes, it's not just about hearts, it's not just about some of the things we can currently DNA test for. Because those DNA companies are coming out hard and fast with new things all the time.
Well, they dropped our test.
Which test?
I only have one DNA company I can deal with that will give me the eye exam for the Karelian Bear Dog and the Norwegian Elephant. Everybody else has dropped it. It's like an ACC 10 something.
Oh, really?
And I'm like, I paid money for the first one. It came back, and I'm like, this isn't the test I signed on for. She goes, well, that's the one we have now.
Interesting.
So now I have to retest their eyes again for another DNA company.
Yeah, but we're going to start seeing, there's some of these cancer tests, they're getting really close. Like lymphoma and hemangiosarcoma, we're going to start seeing DNA tests coming out for some of those, which is going to be really valuable.
That's going to be nice.
The problem is we're going to start throwing dogs out of our gene pool, and people already have been, for disorders that shouldn't really be eliminated from the gene pool. So it's going to be harder and harder because a lot of people don't understand the DNA test results and how to interpret them, and the general public is going to start putting pressure on us. We've already seen people making nasty posts on Facebook about, don't you test for this and don't you test for that. And it's becoming increasingly challenging to know how to use the DNA test. There's a new DNA test in my breed for the Danish Swedish farm dog that has incomplete penetrance. Well, what do you do with that? It's not simple autosomal recessive, so it's not as easy as just yes or no. So it's getting more and more complicated, and the more tests we have, the harder it's going to be.
So will they ever do a breeder DNA for how to interpret our results in as they continue to get more and more in depth?
They will, yeah. I've been to several of the paw prep presentations. They're great. So I would be looking for those. And those lectures do show up sometimes online, sometimes at breeder symposiums that may not be mainstream breeders, like, you know, they may be at the commercial breeder presentations, but there's a lot of value in going to those. And a lot of states do have those presentations. You just have to seek them out, and if you let me know what you're looking for, I can help you find them. But the Rob Westra from Paw Print Genetics does a tremendous presentation on how to interpret coat color and how to interpret other things. So it's really good and really interesting. So there's a lot of information out there. You just have to know how to find it. Yeah. So I think he probably needs to do more of those online, and maybe he has, and I just haven't looked for the YouTube videos that exist. But I think Rob's presentations, Dr. Wester's presentations at Paw Print, are really insightful and really effective because he helps you understand what to do with that information. Yeah. Other questions? No?
Okay. Am I crazy?
What?
Am I crazy?
About what?
I want to breed her again.
No, you're not crazy.
Did you have nice puppies?
Oh God, yes.
So,
Okay.
just a little history. We tried 4 times the breeder and only took once.
Thanks to Marty.
And I'll tell you, the same thing happens in horses.
Oh yeah, but that's way more expensive.
I don't
And
I
she's
don't-
7.
I don't know. I don't know.
No, I almost think dogs are higher. Maybe.
And
Not
I
to
mean,
be
you talk
intense.
about the sperm and stuff, and we used on a horse sperm from a stallion, and the vet literally said to us, "I wouldn't be wasting my money because not one of them really swam very straight. They all went in circles, but somehow she got pregnant."
It only takes one.
Oh, it takes more than one. It takes one to get through the zona pellucida. It takes a whole bunch of them to hit it. And if they're swimming in circles, there's also, there's still the uterus is propelling semen forward. There's still other mechanisms
It
besides
just-
the swim.
And so we named him Ferris Miraculous.
Oh, there you
Because
go.
it was a miracle he was ever conceived, because we had poor vigor and it just was not good quality.
Yeah.
So I think it's worth it. I mean, if I stuck it out with a horse like 4 tries, and like the following year we had crap and she got pregnant.
Well, I'll know for sure
So-
when we get the tests all back where we're at.
So,
But
what about age? She'll, so next time she's in season, she'll be close to 8 years old.
It does diminish fertility, and she already has diminished fertility. But what we did last time worked.
yes,
So we have to repeat.
with 7. I really don't need 7 again. Be happy with 4.
You don't get to pick.
Yeah, you don't, because I had Carrera. She was 8, and she was supposed to have 7. Chianti was supposed to have 7. We had some issues, but they were 8 years old.
Well, mine was during COVID, and my last puppy that didn't have a home, he's got a home now, ours. So I ended up keeping 2 litter mates with access to a 3rd litter mate. And I'm like, I want to wait.
And without knowing, we actually kept 2 boys from the 2 different sires.
Oh.
Because I want to do dual sire again.
Yeah, and that's fun. So they're half brothers.
Yeah.
Brother, half brother.
Which freaks everybody out, because the first time we took them out into the ring, everybody's like, what's with the numbers? Because they were looking at their registration number.
Yeah, the numbers are wrong. That's-
Right. The numbers were different.
They
but had
came
the
up
same
and they're
birth
like,
date.
your numbers are wrong, you did something wrong. And I looked at them and I said, I had a dual sire litter. They have different dads. It's technically registered as 2 separate litters.
Right. And I've had that too, because I did.
So you did that on purpose?
Yes.
Yes, and I
Very
had
good, cool.
actually, because our pool is not very big, so
Barely
my,
get your ankles wet. when
my
you go in your
wonderful
gene
lady
pool.
came from Illinois and stayed at my house, and we did Ozzy, and then my other wonderful lady came from Duluth, Minnesota, and stayed at my house.
Stayed in our camper.
And we had the girls
What it
over
takes.
with both studs, so we could do the side by side here, and then natural in the front yard. Because I didn't want to be a backyard breeder, so we did it in the front yard.
You're very.
So the neighbors could see.
And apparently, this was the first time for Tony breeding a dog. She was the color of your shirt. She is so
people
embarrassed.
People are driving by and
Oh, that's
these dogs
hysterical.
coming out.
And Lucy's a screamer.
Oh, good. That helps a lot.
I was at
That's when you gotta just stay there.
I live in a tiny little. I live in El Dorado, which 3 bars, 1 church,
Yeah.
and everybody who drives
And a post
by
office.
waves either on their lawn tractor or their 4x4 or whatever.
Yep.
And everybody waves.
Yeah, of course they do.
Makes me laugh, but yeah.
But so we had a dual sire litter as well, where we did on purpose.
Swedish or
Pembroke's, yeah. So we shipped semen from 2 different stud dogs, and had a combination litter. So I had 1 puppy from one sire and 3 from the other.
See, I met a lady who was Scottish Deerhounds in Racine, and she has never met anyone yet who did a dual sire and had puppies from both.
Yes, and
She
that's
couldn't
what
believe I did.
Yeah, that's what I hear. But you did, I did. Clearly, it works.
Yes.
But you also hear of people that have had an accidental additional breeding where they've had half of the litter purebred and half of the litter not purebred because the neighbor dog jumped the fence or, crawled
So-
over the kennel or whatever. So you can have purebred and non-purebred in the same litter as well.
So that's one thing. Having gone through it and having gone through getting all the DNA tests and the results and trying to figure out who's the daddy. My Warren Povich moment.
Did
I
you
kind
interview
of
him?
feel like the AKC should require that DNA testing for every litter, even if it's just a single, because the cost. So it's $25 per litter, $2 per puppy. So that's $50, $62.
Yes.
But an extra $200 because we did dual sire.
Yes.
I could have said, well, it was all one, and
Oops.
save myself $200 and some
Right.
dollars.
Right. So you think that there's a disincentive there?
I do, and I think there's also, like you said, you could have had somebody jump the fence, or we could have had Colt. Our other elk hound just accidentally jump her, and we would have had all purebred elk hounds, but
Right.
what would you know?
Right. So I had a situation that with one of my breeds that I used my frozen semen on a friend's dog, and when that puppy came in at 2 years of age to have his semen collected, because he was having semen frozen and because the litter resulted from frozen semen, there was a DNA test on file for the father, and AKC contacted the stud dog or the owner of the bitch and said, this puppy cannot be from this sire. So, believe it or not, AKC does pay attention to the DNA tests that they get on frozen semen. They don't do it on all breedings, but they did on this one. And they commented that this dog could not have been the result of that litter. Well, it turned out that we did a frozen semen breeding, but apparently that night one of the other dogs had gotten to the female, and so she had a dual sire litter without the client being aware of it, but AKC knew. Because it was frozen semen and then frozen, when he was frozen, they looked at the DNA and did the little chart and said, you cannot be the sire.
Yeah.
So there is some of that goes on. And I am frustrated by that. I think you're right. I think we should have more DNA tests. I think we should have more microchips. Why at an event, a performance event, aren't they checking your microchip to see if the dog you're presenting as that dog is really that dog? We all know people go to North Dakota to show dogs because who's going to notice that that's not really the dog? We all know people switch
I
them out.
did know that, to be honest with you.
We all know people switch out dogs at OFA hip x-rays and eyes and that, these kind of health clinics. That's why microchips, they aren't going to publish the OFA information unless you put a microchip associated with it. Good for them. But why doesn't AKC, why don't the other stud books, field trial stud book, why doesn't UKC, why don't these other organizations require a microchip for a performance event? Hoop scanners exist. You could walk through the hoop on your way into the ring whether you're in confirmation or field trial or whatever, have the dog to verify that that's really the dog it is. And, you know, AKC, UKC, they're afraid to do it because they're afraid people won't show up. Well, guess what?
They're really not showing up.
And the American public is mad about the kind of
Like she said,
dishonesty
you have
that
to have
takes place.
transparency.
You do. So why aren't we saying to the AKC, we want to have our dogs scanned to
And
show
even,
that
even
that's
if
the
these
dog?
clubs that are putting on these events don't have the money for some expensive thing, I bought one off of Amazon for
Yes.
$50.
Yes.
And it works great.
Yes, it just takes a little longer if they have to scan each dog and look at the catalog as opposed to walking under a hoop scanner, having a printout, and going to the catalog and verifying it. Takes an extra, 10 seconds, 20 seconds a dog? Yeah, I think that people like you and I should be saying to AKC, we need to know that the dog I'm competing against is really the dog they're representing it to be.
Unlike you, who took a bitch in for the best breed
Ah,
of a
that
dog.
was- that was funny.
Well, we had a client that
Okay.
accidentally took the wrong dog in, and she realized it after the judging was done, and she went back over to the table and gave her ribbon back. How many people would have done that?
Well, I
He
was
took a
showing,
bitch in
I was
for a
showing
male.
for
That would
somebody
be a
else.
problem.
That's
And,
kind of funny.
And so I got done showing Lucy,
Took a female.
went over to this lady, and she had her two dogs, a male and a female. She handed me the leash. Said,
She
"Here
handed
you
you
go."
Gabby instead of.
And she says, "Here's Indy." And so I grabbed him and went in, and I was the first one around the ring, and he wasn't showing right. I'm like, "Indy, come on." He's just not
He's
responding.
like, I'm not Indy.
The judge came over and felt them, and I went around, and he goes, "Sir, I need to check that dog again." He's like, "This is not a male." And then by that time, the owner was standing at the ring trying to get
Cease
in.
was so embarrassed. She's like, I had to come in, he's got the wrong dog.
You know, from the top down, I couldn't
Yeah.
tell.
Yeah,
They're all
that
the
is a
same
little
color.
embarrassing. Yeah, and there are definitely breeds that you can tell the sex of a dog by looking at them.
Yeah.
You know, they'll have a bigger build, a bigger head. You look at a Sheltie, they all look the same. You look at certain other breeds and you're like, oh yeah, that's definitely a masculine male or a feminine girl.
So she had a masculine, she had a very masculine batch of what she did, but it, we laughed. We only had one pro handler in the whole group. Well,
Yeah.
again, we're
She
so
was-
small, everybody knows
The
everybody
pro
else.
handler, I've met the pro handler before, and she was sitting right behind me. So after she went around and we're back in line, I said, "That ever happened to you?" She goes, "No." I'm like,
Yeah.
But everybody else was laughing outside the ring. Sorry.
Well,
hon.
and it wasn't even your fault,
No.
so that's the
More
embarrassing
often,
thing.
I see people that just have the wrong armband on.
Yeah.
"Oh yeah."
Well, in that mass shuffle at the, get this dog, here, this one's in next, and here's this hand. You know how it is when we're showing 10 farm
Yeah.
dogs. It's a mad shuffle with 4 people and 10 dogs to get the right dog in the ring. I don't know how the handlers keep it all straight. They do an amazing
They usually
job.
have a team.
Yes.
Yeah, this one handler, she's got a team of younger people that a lot of times they're just holding dogs. They
Yep.
go in if they need to,
Right.
but most of the time they're just holding
They're
dogs,
just outside the ring.
keeping track of the numbers, and she just shows up.
Y'all just need to come to a Jack Russell trial. If you got, I'm sure you guys understand. You have like 9 dogs at the trial, and you're trying to compete in at least 10 different events.
Right.
So last
right.
last spring we
Chaos.
were in.
I liked it because I
where
like
were we
the
in
working
Missouri?
aspect of it.
Oh, Purina
Prida
Farms.
Farms for our national.
The
And there was
Purina
a-
Dog Trial?
Yeah, and there was a Jack Russell
Yes.
trial.
And you had an
down
elk
hills.
hound there, and she actually took
Yeah.
second place.
Somebody with the elk hound actually went into Jack Russell.
Because it was
trials.
open to
It was open to
Oh,
whoever,
right.
and did really well.
Earth Dog.
Yeah.
It was Earth Dog.
Oh, okay.
Yeah.
And I'm like, wow. Then she came back over to our side, and I'm like, where were you? And she goes, well, we were walking around, saw Earth Dog, and we thought, we'll enter. I didn't even know you could do that.
What is it?
Elk hounds.
Elk hounds are
They're
they're
hounds.
versatile farm dogs, so
Yeah.
they're eligible for everything.
Oh, okay.
They're a hound.
They are a hound. You can hunt with them too.
Okay.
They hunt in their native land.
What did
And
they
what,
have?
isn't that they were originally
Elk.
bred for?
Moose.
Oh, there you go.
Okay.
He's got the
Breaking
shirt.
through. Yeah. Chasing the moose, breaking through the net.
They chase moose in Norway. To get their championship in Norway, they have to get their hunting points first.
Constance.
Yeah, they have to prove they can hunt before they can even go into confirmation room.
Yes.
Yeah, the Europeans are much stricter about performance than we are.
Well,
and they show them like dressed like this. They don't even get dressed up.
yeah,
We
they
don't
are.
either in the Jack Russell world.
No.
No. Well, the handlers in the European confirmation rings dress up, but the other people.
Not when it comes to elk hounds.
Yeah.
Some of them actually show up with the rubber boots on straight from the field. Because their shows are hit and miss at best.
Yeah. Why not?
Well, I could see that because I was in rain boots in one of the trials this year. I did agility in pouring rain. That's one I'll never forget because my dog ended up getting her agility title.
Yay!
But it was in the pouring rain.
Well, your little Dream, oh my gosh, the pictures of Dream and Solveig, she was doing fast cat with them, and she's got pictures coming straight at her, and there was water just,
Oh, cool.
just
It had
big
been
arcs of
raining
water.
for 3 days, and the track had a dip in it, and the dip was full of water. And a lot of people were pulling their dogs. They weren't running them because they weren't going to get good times, or their dog could get injured. And I don't know, my little dogs, they run in the rain all the time, because they're on the farm. And so we went, and the pictures are really cool.
Yeah, there's an arc of water coming up out of both sides. And
you have
Dream
pictures?
has
I'd like to see that.
She is so
I think we
proud
all want
of
to see
herself.
that. Right?
Well, I'll find it.
Yeah.
Just give me a
She's very proud of
second.
herself.
Elk hounds will go out and burrow in the snow and lay there all day, but
Yeah.
you go out in rain, like, ooh, water, no.
Yeah. Then we have the Finnish Laplands. They're the ones that herd reindeer. It's really interesting, the different breeds and what they were originally meant to do.
They herd reindeer?
Yes.
What dog is a reindeer herder?
Finnish Laplands.
Oh, cool.
That is a
And what breed is that? Is that what?
That's a Danish Swedish farm dog.
They do look like Jack Russells.
Yeah.
Oh, yeah.
Yeah. They're
They
not
have a nicer
terriers.
head to me.
They're
They
not
have a
terriers,
rounder
so they're
head.
trainable.
That's really cool.
They make it very
Just to
clear.
be
If you
fun.
say,
Oh,
it looks like
yeah,
a terrier
that
to a
is
farm
pretty
dog
awesome.
person.
Oh, yeah, sorry.
What are the? I've seen your dogs before. What I can't.
I have
I'm
a
good
bunch
at
of them like
describing
this. I
why
mean.
they look different than
See, here-
Jack Russells.
Well, they're not built quite like a terrier. They're not as straight in the front. They're
Oh, that's cool.
they're
He jumped
rectangular.
right into my
Just
arms at the end of the course.
I mean, they're still very athletic dogs,
He's like,
and
"Mom,
JRTs
it's
are really
a
athletic, but
Australian."
they're just different. Some of them have a natural bobtail, some
I
have a
have
full
cute
tail.
pictures with her just
They got-
staring at them.
They're supposed to have a
Oh,
thick
yeah.
barrel chest, and as I
Yeah,
understand
so
it,
what
the
else do you do
JRTs
other
are
than
supposed to
that?
have sort of a slab-sided chest that they fit down in a
that's
hole.
cool.
We're supposed to have a thick barrel chest
It looked like that dog.
with a head that looks too small for their body.
Yeah, that looked.
So that's kind of
Yeah.
the proportions that you're going to see that are going to be different. But to the untrained eye, to somebody that's
That's my
just
little boy.
at the dog park,
At
they're
the end
gonna-
of the track,
they're
he
going to think it
whipped
looks like a
around
terrier.
after
There's so
everyone,
many
and
of
he came
them
back
that
there
are
wrapped up into
breeds
my
that-
arms.
Well,
He's
and
on
so
the track.
there's a lot of
He
little
was
mutt dogs
soaking
that come
wet.
through the Humane Society that look like a farm dog. You
Right.
see commercials on TV, you're like, is that a farm
She's
dog?
all
That looks like a farm dog. I wonder where they got that. Oh yeah, it's probably a knot.
We just bred her
So-
one day.
Yeah,
So,
yeah.
I keep petting her on the tummy and going, nice little babies.
Did you light incense and pray to the fertility gods? Do any of that? Oh no.
But I did light some white sage.
There you go.
Good
That counts.
feelings.
You gotta have the fertility gods on your
Oh,
side.
God. Well, I don't know. I just hope she's pregnant.
So how big are your litters when it comes to Swedish farm
Well, the current litter I have is 7.
dogs? Is that what you're holding?
Yeah.
They are adorable.
Where are they?
They're over
They're
there.
in Dan's office. Yeah.
How old are
So we
they?
had 7. They're 4.5, 5. They'll be 5 weeks old.
He's right behind you.
Okay.
What they do now?
I think we should have a puppy fix.
Yeah. So that's the biggest litter I've had is 7. And she just laid down and squirted them out, just like her mother had. So they're good little whelpers. I have had 1 C-section.
Same day as mine.
Is that right?
Yeah, you walked by me and I said hi. I don't remember what was going on with our C-section, and you're like, I'm doing the same thing. I'm like, oh.
Yeah.
She goes, but it's my dog.
Yeah.
You just kept
Sure,
marching.
but it's my dog. You mean my farm dog when she had the C-section?
Yeah.
Oh yeah. Well, she'd been in labor since 5 o'clock in the morning,
Yeah.
and there was no puppy out, and that's pretty atypical. Usually by then they've had the whole litter. So first puppy, the only puppy in the litter that was a female was the stuck puppy, the only girl in the litter. So mother's name is Umanya, which means Queen of the Ocean. So we named him after Queen songs. So what do you name the stuck female puppy? Fat Bottom Girl.
It's funny though.
That's hysterical.
But you know what I
I don't know what you named
They're
her.
all named Queen songs. So we are the champions, and you know all those. Bohemian Rhapsody. We had a great time naming puppies.
Another one bites the dust.
No, we chose not to pick that one.
Not
That's
even that one.
rough.
That one.
But yes, so she'd been in labor since 5, and my staff comes in at 11.
Yeah, you'd been there.
Uh-huh. Oh yeah, I was there with her, catheter in, ready to go, everything's ready. And my technician's like, "Well, they're first." And I said, "No, you don't understand. My dog is first." And she's like, "But they," I said, "My dog goes first." And she picked her up and realized that there was placental membranes in her hand. And she went, "Your dog goes first." I said, "Yeah, because she's the one in trouble."
Right.
So yes, but I'm fast. I mean, it didn't take very long. Like I'm in and out of surgery in 35 minutes. So
Yeah, and I wasn't pressed for any reason. I mean, I was there to have C-section, but I mean,
Yes.
I wasn't.
you didn't have fat bottom girl.
Right.
Yeah, stock.
Was
Yeah.
she folded over or just positioned wrong? Or?
I don't know what exactly happened. I just pulled him out fast. Just wanted to get her out, and you know, I was really lucky. I didn't lose my only girl. So yeah, because usually the farm dogs just squirt him out.
So do you think I'll have trouble with Dream, seeing how she was so tiny?
I don't think so, because all of her family has had easy whelpings. So
Okay.
hopefully not. But
And you didn't see any strictures or anything when you inseminated her?
No. Nope, everything went good. So we'll just A, hope she's pregnant, and B, plan for
We'll
her
all
to
do the
have a-
fertility dance for
There you
you.
go.
Okay.
Yeah, you have to have all the right.
I've delivered hundreds of litters, but this is
I know it's different.
different.
Yeah, you'll be fine.
So I have my girl who's due in 2 weeks, and Dr. Greer ultrasounded her, confirmed she was pregnant, and she goes, "You do realize," and I'm not even thinking of names, "this has to be the candy bar litter." And I'm
Well,
like, "Oh yeah, you got a point," because Dad is O. Henry, and the girl is Cookies and Cream.
what else would you name that?
Yeah.
But candy bars.
Beer.
No. Oh, Henry and Cookies and Cream? It's all about
Or
candy.
cookies.
Oh, you could do Lindt chocolate. You could do like the makers instead of just actually candy
Wow.
bars.
Good diet.
Yeah.
Well, that'll be the little princess, I'm sure.
Yeah, we'll come up with good
Well, I'm
names
coming
for you.
up with dream names for my litter.
Well, and she's due on Thanksgiving.
Day after. Well,
Yeah.
the C-section is Thanksgiving.
Thanksgiving would be the C-section date.
Oh, so you'll be working again?
Isn't that a surprise?
Thanksgiving is the C-section date, and if you don't do the C-section, the next day
Mm-hmm. Was her
could be the C-section date also.
Oh yeah. Mm-hmm.
But Jack Russells, if you had to have C-sections with Jack Russells,
Not most of them.
I have one girl that she's just tiny, and she's here. Actually, she had progesterone today, and we used her as a teaser for her brother. So wrong in many ways.
They're dogs. Who cares?
They don't know the difference.
But most of them know. I had some situations where I was hauling my butt up here for a C-section, where a place said she wasn't in enough distress to do a C-section, even though I said, "I know my dog. This is not typical. Usually within 20 minutes to a half hour of her first contraction, we have a puppy. We are going on 2 hours. There is no puppy." They sent us home. She did deliver one puppy. She was supposed to have 7, and ended up coming up here, and she's like, "Get up here now." And so she did the C-section and ended up coming home with 2 out of 7.
Ooh,
Yeah, they got stacked up. Didn't work out well.
this is why I love C-sections.
what
Yes.
what is the deal? This is kind of a big
Which is why
question.
I'm now getting gun shy about doing natural labs.
With veterinarians, because there's no repo veterinarians. There's you.
There's a few.
There are a few. There's
It's a
another
big push
one.
on spay and neuter.
But if you like, I'm down 2 hours away, so I have to like pick and choose and find veterinarians that have like this much. You know, they'll tell me something and I'll be like,
We used to see Dr. Joe.
Yeah.
We have
Just a little
Woodstock
bit
right
closer.
next there.
So you two have spoiled us versus, like, I just had a. I'm sorry. I
Dr.
just
Joe's
don't-
great.
Yeah, she's retired, but yes, she was. But we just did a progesterone test, and it was 2.2. And then we went back 2 days later, and he's like, "Your dogs are just crazy. It was only 2.1. That's not the way it goes." And I'm like, "Oh, really?" That's exactly the way it goes. I'm at a seminar on Saturday. Do you want to go? But anyway, they
And
just,
unfortunately, a lot of veterinarians don't know how to interpret progesterones. At 2, they're going
Right.
to tell you, "Oh, hurry up and breed."
I know.
You know, there's just
you're
a
right.
lot of misinformation, and they don't do a great job of teaching it in veterinary school. They do a great job of teaching spay and neuter. They do a great job of other things, but they don't do a great job of teaching repro. So this year, this past March, I was asked to teach the repro section at UW. They started off with giving me 5 hours, and they cut it to 4.
Oh.
So in 4 hours, I'm supposed to teach male and female fertility in dogs and cats, infertility, spay neuter, neonatal care, pregnancy management, C-sections, all of that.
You answered
in
my question.
4 hours.
That's why it is.
What's that?
That's why it is because they don't
Right.
have any
No,
time.
they don't.
Right, they give them 4 hours. And I've been down there before and done presentations for AKC because the AKC will get in there for an hour. And I've had students come up to me at the break and say, "Dr. Greer, I thought when I started veterinary school this is how it was going to be, and everybody else is anti-breeder, anti-everything other than rescue, and you're the first person I've heard speak positively about breeders and breeding." So it's discouraging.
If everybody starts being anti-breeder, they're going to be anti-job because they're not going to have a job.
Yes. Yes.
But they don't make that
Unless-
correlation.
But there,
It's frustrating.
it is. I mean, because I've gone there before I met Dr. Greer. I went there. I had an issue. Very small puppy. Mom was only wanting the small puppy, who she should have rejected, and lashing out at the healthy puppies. And we go to the UW, and I'm like, "What do we do with her, this puppy?" Pneumonia, failure to thrive, 4 days old. So they put her on antibiotics, and they don't teach you to tube feed. And they send you home and say, "Yeah, just keep doing what you're doing, and hopefully it'll eat, and hopefully it'll live." And the first time I learned about tube feeding, I'm like a nervous wreck, but I'm like, I need to do this, I need to know. And I go home, and I tell my other half, we have to tube feed. And he goes, "No, I'm not having anything to do with that." I'm like, "Just hold the puppy and shut up." And I think I've become pretty good at it.
You're really proficient at it. Yeah.
And I've learned to be able to do it myself. But that's one of the things that if you're teaching school, what are you teaching if you're not teaching a breeder or anybody, regardless, if it's an oops litter, how to tube feed if they need that?
Right, even rescues have those situations. So one of the things that we've tried to encourage is for breeders like you to take vet students under their wing. Take them to performance events. Take them into your home. Show them how you groom. Show them how much work you do. Show them how it is to whelp a litter. Show them how it is to raise a litter. Teach them this stuff because the students are coming out with no experience. When I graduated from veterinary school, I didn't have a lot of reproduction experience, and I got asked by the Fond du Lac Kennel Club a couple of years into my living here if I would come and speak about breeding and pregnancy. I'm like, okay. And then I realized I'd never seen a normal whelping. All I'd ever seen were complicated whelpings that ended up with C-sections because I wasn't breeding my own dogs at that point. So if you are all willing to take a student under your wing and say, "Hey, we're going to go to Fast Cat, we're going to go to Agility, we're going to go to Earth Dog, we're going to go to Conformation, we're going to go to Tracking, you want to come along?" Teach them this stuff. Let them see what you do with your dogs. Let them see the purpose of purpose-bred dogs because they're not seeing that. All they see is rescue, rescue, rescue. And so they don't understand they're purpose-bred dogs. They don't understand the performance. They don't understand why people who are doing this want them to be taken into the fold. And there might be 1 or 2 students in every class that are interested in those kinds of events, but if you teach it to them, they'll be more interested. If there's 1 or 2 students in every class, probably funded by HSUS and PETA and all those things too, so they're up against a very difficult situation because
They have way more PR than
they do.
Well, it's retail rescue. I mean,
Yeah,
it's
exactly.
$1 billion business.
Exactly, and we all know it's
I
happening.
do have a question. When you hear people yell and scream, adopt, don't shop, how do you positively engage with that? Or do you not?
Sometimes it's difficult to be positive about it, but basically it gets down to predictability and purpose-bred dogs. If you have a purpose-bred dog, you know how it's going to act, how big it's going to be, what its coat's going to be like, how you're going to live with that. There's all those things that you can really help educate them about. National Animal Interest Alliance is a great organization for that kind of educational piece. So there are definitely places that you can teach it, but when you're 70 years old and you go get your last dog, you can't go to the pound and hope that what you get is going to be 20 pounds. Because I've had clients expect the dog to be 20 pounds and it turns into 140. And when you're 80, you can't pick up the dog and get it into your car. You know, there's a lot of things about purpose-bred dogs and the predictability that goes with them. It's great if you're elderly. It's great if you have kids in the house. I mean, there's a lot of reasons that you want to know. Do I have to run this dog 3 miles every day? How much grooming is it going to take? How much food is it going to eat? Can I pick it up and carry it if something happens that it can't get up and walk? Can I get it into my car by myself? That's the predictability piece that we're missing when we go to rescue. And maybe when you're 40 years old, a rescue's not a bad idea. But by the time you get to be 70, you might have, or if you're going to have kids, who wants to have some of those dogs in their household with a kid? You want a golden retriever kind of personality in your family with that bunch of kids running around the house. You don't want the pit bull terrier, that mix that's going to be, you know, a dangerous dog to have around them. Do I profile dogs? Absolutely. Should I? Probably not. But reality is, it happens. I see pretty nice golden retrievers. I know I can trust those with little kids.
What are your worst bites? You've been in the industry for forever. Who have you received some of your worst bites from?
Bernese Mountain Dog and a boxer.
So I have a question.
Who did you say?
A Bernese Mountain Dog and a boxer.
Are the worst biting dogs?
They're the
No,
worst bites
that's
I've
what-
had.
Just due to size?
I've only ever been bitten once in all the years I've been in dogs, and it was a Shih Tzu. And I was grooming it. And
Yeah,
it
you
nailed
can have
me
the,
good.
I mean, any breed can
Yeah,
bite.
I mean,
It's a matter of how big is the mouth and how much damage can they do.
Well, I'm sure it's still the same. The most bites every year is Labrador Retriever.
Yeah,
It's 'cause
because
there's
But they're the
8
biggest.
gazillion
they're-
of them.
right,
Yeah.
because that's the number one number of registered dogs in the
But
country.
they're not all well bred
Right.
either.
Right.
Just because they're
He's
registered
not
does not
saying
mean
that.
well
He's not
bred.
saying
I'm
any
not
of that.
slamming.
He's
I'm just saying that's
the
just the
number is
number.
high because that's how many.
Right.
Yeah, there's that many.
Right,
of
but
that
if you
breed.
look at statistics, what category of person gets bitten the most? Do you know?
Child, I would think.
Teenage boys.
Really?
Oh yeah, because
They're
they do
drastic.
because they do stupid stuff.
Right,
Teenage boys,
right.
they cannot help themselves.
That would make sense.
Yeah, because they jump at dogs, they do stuff with dogs,
Right,
they
right, they
wrestle
do
with
that.
them. Yeah,
I watch
you know.
the kids when they come to get puppies, and it's right in that 10 to 12-year age.
Oh yeah, they have out-of-body experiences, and they just don't know what they're doing. It's like, really? Did you understand what you just did? What? They don't get it.
This is
So-
why we got a puppy from the vet kids.
So yeah, statistically, that because there's so many more labs or lab-type dogs, because how many of the bites, it looked like a lab, so it got reported as a lab.
Yes.
It was a big black dog. So, but yeah.
I'm not part of AKC, so JRTCA has a breeder profile that I ask all of my potential puppy people to complete. Does AKC do that for each breed?
Breed club, maybe.
Yeah, the breed clubs might, but AKC universally doesn't have that.
I would
Phrase
bet.
that again.
So it's a breed profiler. So it's a series of questions, and it gives you an outcome at the end of a percentage.
Oh yeah. Okay, so AKC does have
as
Yeah,
far
what
as
kind of
breed
dog is
suits
best
you?
for you?
right.
Yeah.
Is this,
Find a breed, yeah.
would you be suitable for a Jack Russell?
Kind of like that book we did.
Daniel Tora. The Right Dog
Yes.
for You.
That,
Yeah.
that
I
is
love
a-
that book.
That is a great book, and unfortunately, it's out of print. But you can still
Really,
buy
I have
used-
3 of them.
You can buy used copies.
I loan them to people, but
Yeah.
I tell them,
That's how
you
we
get
got
it
it
for a
now,
week, I get it back.
Right, right. So it's Daniel Totoro's "How to Choose the Right Dog for You." It's
Yes.
a fantastic book. It's
You
got
got
charts in it.
Forgot to go to the main.
There's one there. I went upstairs.
I'm going
So there's it has charts in it for sociability.
Yeah, it's a bunch of grids.
Sociability with strangers. It has activity level, coat care. It's got a whole list of
It's
criteria.
basically a bunch of questions about your personality and what you're
And your
willing to put up
lifestyle.
with.
Right.
And then at the end of each questionnaire, you get a score, and you match that to a chart. And there's a bunch of dogs in that square of that chart. You write them down, you go to the next personality quiz, and then you keep doing that, and it narrows down that group of dogs.
Yeah.
So
Yeah.
mine came down to elk hound and basset hound.
Well, both hounds. Yeah.
Yeah.
Yeah, just one's taller than the other. But yeah, and of course there's breeds that aren't included in that because
Yeah.
that's an older book and it's been out of print for a long time. But it is a great resource for helping. And yes, I get people from the farm dog. I don't get any corgi people that way because corgi people think they want a corgi when they saw a cute one on a commercial. But the farm dogs, we get that way, and they're like, "Oh, I did this thing on AKC's website, and it said I should look at this breed," and so they'll call us about farm dogs. So yeah, we are starting to see that, but I've never actually taken it. Has anybody?
I have.
Have you?
Just for fun.
I mean, you
what did
can
it tell you to
skew
get?
your score.
Oh, of course, like any other personality test.
Well, you're supposed to be honest, though, right?
Yeah.
But I mean, because I do ask my puppy people is if they've never had a jack and they want to get a jack, I'm like, please take this, and then I give them some references from the JRTCA website if they have specific comments to me that they have kids, and I'm like, you might want to look at this, or they have another dog in the household, and I'll tell them if it's under a year of age, I will not place another puppy under a year of age in your house. Sorry, just won't do it.
So do they tell you a reason why they want a jack?
They do. A lot of times it's just because they want something smaller than a lab.
They want an athletic dog, but they don't want a foo-foo dog.
Right.
So they don't want a little Maltese. You know, it's small, but it's. I mean, they're nice little dogs, but it's not everybody's style.
Well, I had a couple that came and it ended up being a good fit, but I was kind of like, wow, lady, you are a lot for me. She had a Shih Tzu that she carried around in a little backpack. And I'm like, the dog has legs, it should walk. But they go hiking and they take this Shih Tzu with them and she carries it in this backpack. And I'm like, the dog's legs are not broken. I thought that was cool. But the husband had a jack and the husband wanted another jack again. And all she kept saying was, oh, she's really fast. Like, yeah, because you never let your dog walk.
That's funny.
So what was she carrying around? A jack?
A Shih Tzu.
Oh, a Shih Tzu. Okay.
Isn't that Matt the coat just sitting in the little couch?
That's an interesting combination for a husband and wife team.
Well,
It's interesting.
she came with a Bichon Frise and this little Shih Tzu. And he had the jack.
Yeah, but jacks actually levitate with energy.
Ours was named Boing. We went like, and she did it too. We taught her to boing, boing, boing like she was a ball.
Oh,
That's pretty good.
It's fun.
What are you?
A Eurasia.
A what?
A Eurasia.
I don't know what that is.
It's right here.
It's a Spitz type.
Yes.
Yeah. I did a webinar for your club.
Did you?
Yeah, I recognize the name when I read.
How
Yeah, we
long
talked-
ago?
Oh, probably 6 or 8 months ago about blasto.
I've
Oh,
never seen one
okay.
in person. Can I see you?
I missed that one, but I do remember we had
Yeah,
it.
it might be recorded. I'm not sure.
She's a little nervous after being next door.
Don't blame her.
Or
That's exactly,
She's just gonna lay on your head.
By that window.
I think they're more Velcro-y, aren't they?
They can be.
They can
Yes.
be. Soft.
Yes, they.
It's a very soft hair coat.
No, but you meant personality.
Yes.
Velcro.
Yeah,
Yes.
yeah.
Some
Up
of
to you.
the Eurasiers are very Velcro. Yes. She's really not, but
They're made
she's
to-
in a weird place.
They're
right
actually
now.
made to be with their family.
Are her pupils dilated?
Yes.
Yeah, she might be just a little
Yeah,
Oh, yeah.
that's
off
part of it.
balance from.
She's
She just had her eyes done.
Yeah.
And she passed. So.
Well,
Yeah.
Yay!
So do you have questions?
Well, we're just listening. I'm
Oh, okay,
absorbing. I'm hoping to be a new breeder, so I
Great.
just thought I'd absorb as much as I
Great.
could. And
Good. You
So,
know,
do they have eye issues in your mind?
it's more
Being
of an
Eurasia?
eyelash.
yes.
eyelash.
Oh, so they have the ingrown eyelashes.
Can.
Oh, they can. Okay.
Yeah, so.
Entropia? Or is that different?
I-
Probably
Entropia. Yeah.
dystocia or entropia.
One of the major failures, and it's not that common here, is thyroid with them.
Oh.
That's the main thing they fail. Yeah.
Like we imported, we got him from Canada. We got a male from Canada 4 years ago.
That's
and
importing.
he ended up failing his thyroid.
Oh,
So
interesting.
she came from South Dakota, and her parents were both on premises, and they both came from over in Europe. And she's a little more leggy than the male. The male's a little more stocky, so he's probably more the chow in the breed. She looks more spitz to me with the narrower muzzle, and she's more petite, but she just takes time to get to know people. She's a little more standoffish,
Well,
which
she
is
can't
what the
focus
breed.
right now because everybody's.
Yes.
Well, yeah. I mean, once you have your eyes dilated, you're like, whoa.
I was just like that last week. I don't blame her.
Yeah.
I was a little
I'm
like
still
sorry.
going to
Okay.
sedate him because he wouldn't have his hips done otherwise.
It's okay.
I figured this would be good for her to just get used to being around
Yeah.
strange things, because sometimes strange things make her really evil.
That's
Yeah,
okay. I'm
understandably.
standoffish too.
So what's her job?
Be with us.
No, I mean.
She's not bred as a companion animal, though. What does she?
But they were bred for companionship.
It's
Oh, that's it?
yeah.
Okay. Where does she originate
That's a
from?
pretty
Where are they
important
from?
job.
That's
That's a pretty important job.
Just say
Germany.
that's it.
Germany. They started breeding them about 65 years ago in Germany.
Okay.
Yeah. And the guy originally bred and wanted a dog that commanded the respect of the wolf but could be with people. This was one of the breeds that when I stumbled upon it in a magazine, and I was really intrigued, and I always wanted to look for a certain breed. And we had giant breed Malamutes, and we had Pomeranians.
Oh, so this is halfway in between.
This is kind of in between, but
If you
it's,
love a spitz, you love a spitz.
Yes.
but we didn't have any children. See, so we take our dogs everywhere we go, pretty much, and they're active enough that they can keep up with us. And as a matter of fact, they're probably more active than we are now because we're a little bit older now.
Cool.
But they're kind of the perfect size to go anywhere, do anything.
Yeah.
Yeah.
Very good.
Like I always we've talked about it a lot. And I go, most people buy dogs on sight. They go, oh, it's a pretty dog. I think I want one, and they don't never look to see what it's about. And then they get it home, and then like huskies and
Right.
Malamutes, they can be so stubborn.
And runners.
Huskies are laid back. I mean, energetic, and Malamutes are kind of laid back. And
Yep.
it's one of those things. Huskies, if you don't work them, they get in all kinds of trouble. The Malamutes we've had, I've used to take them to a park and go for an hour every day with them, and they come home and just lay around the house.
Yeah.
You know what? A tired dog is a happy owner.
Yeah.
That takes all day for Jack Russell.
I
Yeah.
was going to say, it's about 60 miles cross country for us. We'll put some swimming in there.
Amy used to say all you're doing is building,
Steady racehorses.
Yeah, the stamina.
you're building stamina,
Yeah,
leave them
I have a
alone.
different type of racehorse. Getting it race fit.
Yeah, that's right, exactly.
Yeah.
Well, and you stimulate mind as well as body.
Yeah,
And
absolutely.
those are the two things that will wear your dog down.
Well, I didn't
There
plan
isn't
on.
anything.
I did not
That's why
plan
we
on
ended up
getting a
with two of
Danish
these guys,
Swedish
because
farm
now
dog.
we are 20 minutes
After being a breeder forever, and then being with no companion dog for 5 years, I decided I was going to get a corgi because I have all these goats and ducks and all this stuff, and I'm chasing them around, and I needed something that I could train to help me at least move the animals in the direction I wanted them to go. And so when I called Marty about getting a corgi, she said, you need to come and look at something else that I have. And I asked her what, and she told me. And I spent the next 48 hours from the time I talked to you researching everything I could find about this little Danish Swedish farm dog.
Is there a
Because
lot out there on that?
oh, well, I found stuff. I looked at
Plus
every
it's
kennel
European.
in Sweden and Denmark and anywhere's anybody that had a website. I read everything they had. And the reason I was going with the corgi, I always had English cockers, so I didn't want anything bigger than that. And I never had a problem with hair. You know, I groomed all the time. and I wanted a dog. I had known 2 people who had corgis that did agility and obedience and things like that, and the dogs were very work with me. I will do what you want me to do. So that was why I had come to the final conclusion that was what I wanted. Well, once I saw the little Swedish farm dogs and I saw Solvik, he was different than the rest of those puppies in that litter. He was not like the rest of them. He sat and watched me. And he watched me go there, and he watched me go there. And the other ones were busy being goofy and doing their thing and bouncing around. And he watched. And I went, I could get along with that little guy. And so that's how it came about.
Are they like greyhounds where you can't have just one?
Yeah, pretty much. Yeah, and then we have corgis with OCD, obsessive corgi disorder.
No.
Says the woman that has 4 outcomes.
Yeah.
Well, I have
I'm
2.
down one, so I'm entitled to 2 puppies this spring. That's all I'm saying.
So you're gonna add 2?
Yeah, so our eldest 14-year-old Cammy, we had to put her down.
She had her final seizure. And
She had to
that
get a
was
seizure again. I wasn't gonna put her through it anymore.
No.
Well, I'm hoping to get a really nice puppy out of this litter that I can keep, because I am 70. And
See,
Wow,
70 and she's
you
getting
look
puppies.
amazing.
Yeah, right?
70 and getting
Yeah.
puppies.
And
Some things are too old to keep having
my
puppies.
dogs always live long.
I'm 56.
You know, like Flash lived to be
Outcomes live to be
18,
Yeah.
14, 15
and
years.
you know, my dogs live long. So if I have a puppy and it lives to be 18, I'm going to be 88.
That's right. Pretty old.
Just so did
We have
the little
9
farm dogs, I missed that
How old
one.
are your Jackson?
Do they herd? Like, are they helping you get all the
Yeah,
little farm
they
animals?
do a real good job.
I've
You know,
seen-
once
I've
they
seen
see
people
where
say
I'm
they
going,
had 'em up to
they'll stay with me behind me, and if
But
something
yeah,
starts
15
taking off,
to
they'll run and
17,
head it off and
18
send
They
it
don't have
back.
like a border collie.
Your average weight
Yeah.
is in the
Don't
have
a
20s.
Well, I was wondering if that's why
20
you
is
steered her,
something.
because that's what a
Well,
corgi
I
is
have
very
not
good.
trained them to do like competition where they
No,
have to
no, no.
herd 5 animals and
My
get them
one
into
girl
this pen or do
But they
that.
still help you at home.
Yeah, they come out and
For function, they're not
Yeah.
doing what she needs.
when we're moving in, we have pastures that are like 1/8 of a mile away,
Yeah.
and I walk them down. It's Kettle Moraine, and I'm walking them down, and you know they decide, oh, that looks yummy over there, and somebody decides, and if one goes, they all go, and so having the 2 dogs, they kind of flank each other
Yeah.
and keep everybody moving. But we have discovered that Solvik has a new talent.
He's winning everything and he just
Of course he did.
thank you so much.
Have a seat.
Marty, we've discovered Solvik has a new talent.
What's that?
He is a pointer.
Does he really point?
He points.
His little tail goes up? His little
He
foot goes up?
that little curly tail goes straight out, and his little foot goes up, and he leans forward. And we were up in the moraine and the brush, and all of a sudden he stopped like a statue, and he leaned and he pointed.
What did he
Perfect
see?
point. Grouse.
Ah.
What kind of dog
So he's
is
an
it?
upland dog.
Yeah.
Cool.
And I thought, wow. So I told Jim Powers that he's a pointer.
Yes, his Labrador.
Yeah.
Guy, yeah.
And so you come out to the club, and I got to see this. So we went in the back, and we went around where they have the pheasants and stuff are in there. And sure enough, he did it again. And he says,
Did you get some pictures? Did you get
"No,
video?
but
Oh, come on,
you know,
Sharon.
I will. I'll have to take him out again."
Yeah.
But it was like, I don't know what the heck he'd do if he heard a gun shoot.
Yeah,
You know, because I
might
didn't
do
train him from puppy on.
Well, Marilyn has one of our corgis and one of our farm dogs, and she lives right next to TJ Summers' Highland Hunt Club.
Yeah.
So they hear it all. the
Well,
time.
we're right by the Viking Bow and Gun Club
Oh,
and the
sure.
police
Start
department.
with a blank pistol.
Yeah, what I did with my English Cockers was I always used the dummy with the light load blanks, you know, that you
Right.
put in the thing and pop! And it
Right.
would shoot out and they'd run and get the dummy, and it was fun.
Right, so
And
the
then
pop and the fun
slowly
went
put
together.
bigger
Oh, yeah.
charges in until it made a good crack. But the police department trains at the Viking Bow and Gun Club,
Oh, do
right
they really?
through the woods from us. So they hear it in the background.
Yeah.
So
They just haven't been up
it's
close.
not totally foreign, but they haven't ever had anything shoot
Yeah.
close to them.
Interesting.
But anyway, that
Well,
was
good for you.
I'm like, wow, that's cool.
So, how many in here? The cartoon dogs that take the bone and they run outside and they dig a hole and they bury it.
Yep.
Has anybody ever had a dog actually do that? One of their own personal dogs?
My Anatolian does.
I have never until yesterday. And one of my farm dog puppies did that. She had a pelvic bone from a ham that we had. And her mother wanted it. And she's like, no. Her mother's 9. She's 6 months old. She's like, no, this is mine. And she went all over my yard trying to find a place that she could dig and find. And yeah, pretty soon she was filthy and smelly and she was in the sink getting a bath. But I've never seen a dog actually do that. And this morning she had left it outside because when she got icky, I picked her up and threw her in the sink. So this morning she ran out the door and she knew exactly where she left that bone. Oh yeah, she was on it like white on rice. It was pretty funny. Because you see it all the time on the TV, cartoon dogs. But I've had dogs for 35 years. I've never had a dog do it.
One of my Anatolians, she doesn't dig a little hole and bury it. She builds a cave. She'll spend all morning and she'll dig under the cement and she'll make a whole cavern. And then she'll take all her toys and put them in there. All of her bones, all of her stuff, everything in there. And I walk out and I go, oh my God, now I got to crawl in here and get this stuff out and pull all the gravel back in place.
Yeah. I mean, that's a pretty primal kind of
Yeah, but
behavior,
that's what she does.
Yeah. But
Isn't your Anatolian more primitive anyways?
Yeah.
It's a large...
They're not pets. They are not. I mean, they like me. They like to be petted. They're not lead trained. They're not anything. Like when I bring them in for the winter,
They just stay with their...
I open the door and kind of put up barricades and stuff so they go where I want them to go. But they're out with the goats.
Yeah.
And they'll come running to me anytime they see me come. And they want to be petted, but if I make any attempt to grab them, to hold them, they're gone. They're like, duck out, run away.
Yeah,
Bear dogs? Is there Anatolian?
No, Anatolians.
Shepherd.
They're like,
They're a livestock guardian dogs.
they're a guardian dog. They're big.
Like Bernese and stuff.
They look like
Pyrenees. Yeah.
Pyrenees.
like a blonde one more.
They look like,
I think they come many different
well, they
colors.
look more like
maybe
a
I'm just the only
shepherd,
one.
but they're mastiff color.
And they're big.
And they're big, yeah. They
big.
like here when they're sitting.
I have a question.
Yeah.
Are you familiar with the bracket theory of breeding? He was very famous for starting the German Shepherd line.
No.
Okay, I was just wondering.
Anybody know anything about that?
It's called bracket.
Yeah.
No, I'm not a shepherd person.
Hmm?
I'm not a shepherd
Well, I'm a
person.
Jack
I didn't read
Russell
the...
and Griff person, but I've been kind of reading different theories, and I was wondering if
So you don't mean Carmen Battaglia and the okay. Yeah,
no, it's called bracket.
Not familiar with that.
Okay. I was interested in getting you see
Yeah.
what you thought of it.
Yeah, I'd read about it and then I'll tell you what I think about it.
Okay.
But I'm not going to tell you if I don't know.
Oh, great. Right.
Yeah, I can do some reading.
Great.
Other questions? What breed do you have?
Well, I actually did have a question. Recently, our Bernese Mountain Dog, on day 35 for her ultrasound, showed 7 or 8 puppies, and then she had 4, and then had 3 viable puppies. So, we were just surprised that she absorbed them so late, and how that, could have happened. She's pretty healthy,
She's a Bernese Mountain Dog.
Mm-hmm. Yeah, we did it here. Is that just
That
more
does kind of
common?
answer why.
That was answered. If you
I was
did.
wondering too, because we bred her here. It was a TCI, and then it was the progesterone number on that day was greater than 20, but we couldn't. They didn't know 20 what. It just said greater than 20. So if we had done it the day earlier, she probably would have been a better number to breed. Would that have made any?
No, if she was at the right fertility to conceive 6 or 7 puppies, the problem wasn't conception. The problem was the uterine health. We see a lot of cystic endometrial hyperplasia in the Bernese Mountain Dog, and that contributes to it. Unfortunately, we don't have good treatment to manage that. There are sometimes things we can do. Was she a C-section?
No.
So you free whelped her? Okay. Yeah, so if she had had a C-section, we do a lot of uterine biopsies at the C-section if we have fertility issues. And we can take samples at the C-section, at the resorption sites and at the normal placental sites, and have those looked at by a pathologist. We use one at Ohio he's double boarded in pathology and reproduction, Therio. So sometimes we'll find answers, but with a burner, I would say you probably have a pretty good chance of cystic endometrial hyperplasia, and unfortunately there's not a good treatment to manage that. How old is she?
3.
Yeah.
But she had a litter of 9
Yeah.
first, so this was her second.
Right.
Do you think that's, nothing, that's something that she won't?
It's hard to say whether she'll do that again or not.
To piggyback off her question, are there external factors that we should be considering or
What do you-
best practices?
Sure. What do you feed?
From?
Yeah.
Change food.
Change food?
Mm-hmm.
Okay.
Yeah, number 1, change food.
Alright.
Yeah.
What do you don't like from?
It's okay if you're a pet dog. If you're in a
Okay.
breeding program, I'm not a fan.
Okay.
What do you
I'm a
recommend?
fan of Royal Canin and Purina.
Okay. The Purina,
Sport 30-20.
Pro Sport. Pro Sport.
Pro Sport?
30-20.
30-20.
Okay.
Mhm.
Yeah, there's a couple different flavors that comes in.
Yeah.
Then Royal Canin,
Yeah.
they have a pregnancy diet.
You should write it so you can
Right.
understand.
HD42D is the pregnancy diet that Royal Canin makes, and then they have a mother and baby dog formula. And I'm a pretty big fan of that for my boys and my girls. I think we see a lot fewer problems with fertility when we're feeding those diets.
Okay.
So that's the first place I would start would be nutrition. So I didn't tell this story before, but I had a client that came in about 3 or 4 years ago, and he had a line of golden retrievers. And he came in because none of his bitches were getting pregnant. And his father-in-law and mother-in-law had been breeding the same line of Goldens for 50 years. So he was second generation into this breeding program, and they had never had fertility problems before. So on the phone, before he came in, I said, what do you feed? And he goes, oh, well, I feed really good food, which is what I always hear. Feed really good food. I said, well, tell me about it. And he said, well, we have it made by the local feed mill. My in-laws used to have a mink farm, and so they had formula made, which is how From Dog Food and a lot of other companies started off with, was making mink food, and then they transitioned into dog food. I said, okay, well, tell me about it. And he said, well, they make it at the feed mill, and it was custom made for us, and we've never had problems with it. But he said, the bitches that come to me, my stud dogs are getting the bitches pregnant, but it's my own bitches that either aren't cycling, or if they're cycling, they're not getting pregnant. I said, well, you need to go to the feed mill and do some investigation before your appointment, which was in 2 weeks. I said, you go to the feed mill and tell me when you get here what you found out. He comes in and he says, you won't believe what happened. And I said, what? He said, I went to the feed mill and I talked to them, and the formula that we had, he said they are still making the same formula, but they stopped putting in the mineral pack and the vitamin pack. So the food looked the same, the food smelled the same. From his perspective, it was the same food, but none of his bitches were getting pregnant. By the time he came in, I said, if you find out there's a problem, you switch. By the time he came in, he brought me 2 bitches that had started a heat cycle, because I said, you go to the store and you buy Purina today. Went to the store, came home with Purina. By then he had 2 bitches in heat. I said, okay, well, let's time them and figure out what we can do for your breeding program. And he said, well, I'll tell you what. One's a young bitch. If I miss her this cycle, she's only 3. I'll be okay breeding her next time. But the 6-year-old bitch, I want a progesterone timer. I'm like, okay, fine. So we progesterone timed her, bred her. He came in with both bitches for ultrasound at 4 weeks later. And the 6-year-old bitch was pregnant. The 3-year-old bitch was not pregnant, but we did a progesterone on her and she had never ovulated. So even though he had switched the food, she still hadn't made a recovery yet. He has now got all of his bitches back to full fertility. That's all that it was. All that it was the mineral pack and the vitamin pack. And I never found out from him what happened at the feed mill. Was it expensive? Did somebody lose the formula? Did somebody make a mistake? How did this
There
last?
was a guy running around selling that dog food, and we used to add it to.
He was a mink breeder.
He was an ink breeder, but we added it a little bit to her because the dogs had the best coats in the whole wide world.
Oh yeah, because they're supposed to. They're growing mink
because that's what they're doing. Right.
Which
So we put it. This was 20 years ago.
Pro Sport.
Pro Sport. Yeah, Pro Sport.
30-20. 30 protein,
30-20.
20 fat.
Right, and you have to go to fancy stores like Fleet Farm.
If you can find
Lowe's.
it. Purina's been pretty hard to find.
Yes, it
lately.
is.
So's Royal.
Yeah, that's what I.
They've
But
all
the
had
Royal
supply chain
Canin
issues.
is
Yeah.
another one now. Was the other
Yeah.
choice Royal Canin? What was it?
Royal Canin, I either feed the HT42D or the mother and baby dog formula.
Okay.
And where can you find
That's
that?
lights on.
PetSmart carries
HT42D
it.
you can only get
Yeah.
at their website.
Yes.
They don't sell it at
Because
retail.
I feed Royal Canin, that's what
Right.
Dream is
But
on, but
if-
she's on this regular adult.
Sure.
So
But
that
if
wouldn't be
you
like I would need
become
the
a-
HD.
Link us
HT42D.
to be a
Yeah.
breeder.
If you
They have a breeder section on Royal
Right.
Canin's website.
It's free to
We
sign
used
up
to
as a
be-
breeder, and then they drop ship the food, and it comes in 2 formulas: large breed and small breed. And you can probably figure out that you have a large breed dog.
Yeah.
So I probably don't have to help you with that. But you can't buy it at retail. It comes in little bags and big bags. And I'll tell you, it's pretty incredible for what it does for fertility.
So do you add folic acid to your dog's diet?
If they're on HT42D, no. If they're a brachycephalic, yes.
Because a breeder of our other Eurasia is out in Canada on the west coast, and she's a firm believer in what she calls fattening up her females, and she adds folic acid to the diet and things like that.
Yeah.
So I was just curious on it.
Yeah, there was a study done in Poland that was published a couple of years ago, I think it was 2013, that showed in Chihuahuas and pugs that they reduced the incidence of cleft palate by 33 to 50% by adding folic acid. Because there are people who say it doesn't matter, but if you look at that study, it showed a pretty significant decrease in the number of cleft palates in those 2 breeds.
And this lady always had like between 8 and 12 puppies, where the breed is supposed to have 6 to.
Yeah, so
Yeah,
she's
so-
doing really well.
Yeah.
Yeah, Lisa that works for us this spring, last fall when she bred her goats, she'd always had a lot of single and twin of her goats, so she went through and gave everybody a B12 injection when she bred them. A B vitamin, I think it was a multi-B vitamin injection. She had triplets coming out of her ears. She was bottling, because she'd leave 2 on every doe, but she was bottling the 3rd one. She was bringing them to work with her every day. She'd have baby goats everywhere. So, yeah, nutrition makes a huge difference, and we often overlook that. And because the micronutrients are really hard to assess when you read the label of dog food, you can see macronutrients easily. You can see protein, fat, and carbohydrates. That's easy. But the micronutrients, if you look at the HT42D, they've got all kinds of amino acids and minerals and vitamins that are added that really do help. And folic acid is one of the things that they include in the HT42D. So when I breed my bitches, that's what I feed is the Royal Canin food, and that's the only pregnancy diet on the market. There isn't another company that makes it.
Do you have any recommendations on supplements? Say we happen to have a problem, or in the meantime, if we can't get it, is there anything?
I'm a big fan of B12, or I'm sorry, B Strong. That's the Revival Animal Health product, B Strong. That's actually how I got I work for Revival. To be perfectly clear, I work for Revival. And I had a client that called a couple of years ago, and she said, I want you to call Revival and talk to Doc B about PG600. I want you to use that on my bitch to bring her into heat. I'm like, oh, okay, I don't know anything about it. I'll call. So I called, and they put Doc B on the phone, Dr. Bramlage. And he said, oh, Marty, he says, you don't want to use that. He said, you want to use B Strong. I'm like, okay. So I put her dog on B Strong. And 2 weeks later, I got a LinkedIn message from Revival Animal Health that they were looking to recruit me to come and work for them. So now I have another job because I needed a part-time job. But one of my technicians, Katie, that you may have met in Repro, she was struggling with one of her bitches who hadn't come into heat. She wanted to breed her, and she's like, I really want to litter. Will you put her on cabergoline, which is the drug we use to bring bitches into heat? And I said, not until you have her on Purina or Royal Canin, and you have her on ICSB CF+, which is International Canine Semen Bank, and B Strong for 2 weeks. And if she's not in heat in 14 days, I'll put her on cabergoline. But you aren't getting cabergoline from me until you do those 2 things. And she sent me a picture 2 weeks later of the back end of her dog. Clearly in heat. She had 7 puppies on that litter.
So I have not
pretty
used
clearly
my
it worked
bottle,
out.
by the way, Dr. Greer. But the day I was going to use my bottle, that's when I found out that she was in heat.
Yeah.
So you just need to
Wave it
pretend
over.
to open the bottle.
Just wave it over them and they'll come into heat.
And I'm like, well, I guess I don't have to use it.
Yeah.
Isn't that part of the fertility dance?
Yes, yeah. Well, waft the bottle over.
Waft the bottle.
Yes. Have some incense, dance to the light of the moon. You have to have a full moon. Has to all work. Fava beans are good. Yeah, yeah. So all those
This
things
is
are important.
the bee strong.
Be strong.
from Revive.
Yeah.
Okay.
Yeah, and I think a lot of the pet foods are probably depleted in some of those micronutrients, and you really can't tell by reading the label. So when you compare the label at the store and you're like, well, it looks just like Purina, I don't see why I can't buy this. That's the limitation to it, is that the micronutrients aren't there. And if anybody wants the flyer on HT42D, I have it on my computer, I can send it to you, and it shows you every micronutrient that they add to it and where they add it in. And there is soy in the diet, so there are people who have been concerned about soy and the phytoestrogens, but they chelate the phytoestrogens out of it, so it's not adding any soy of those estrogen products into the diet. So if you send me an email and you want the HT42D flyer, it's got a nice graph. It improves bloody show, it improves the formation of the placenta, it improves the uterine lining, it improves everything along the way that you can do to improve fertility. So if I were in a situation where I had resorptions like that, because there's really not a drug we can use. The other thing on burners that have CEH, cystic endometrial hyperplasia, is how often does she cycle? Is she cycling more often than every 5 months?
No.
Okay, good.
Like 9. Every
Good.
9.
Good. That's better for her uterus too, because the more often they cycle, the more they beat up their uterus with progesterone. So that's why a healthy uterus is a pregnant uterus. So if you did have a successful pregnancy, which you did, I would not skip a heat. I'd
Okay.
wear on the next cycle.
Okay.
And try and keep that uterus pregnant for
Well, I'm
as long as you
switching
can.
food
Yeah.
ASAP with them.
Yeah. So you can sign up for their breeder program at no charge.
Okay.
And then all you have to do is order your food and they'll drop ship it to you.
Oh, nice.
But that's the only pregnancy food on the market, and that's the one I feed at our house.
And it's really convenient with the Royal Canin and shipping it and getting on. And the other thing, there is a perk that they do help you with, like your puppies. Depending on how much you purchase through them, they will kind of help you out saying, hey, thank you, and then they give you some puppy packs and stuff. They're not as nice as they used to be, but I understand, but everything is something
Right.
more
Oh,
than
yeah.
what you currently have.
For sure.
So that has always been a great perk with Royal Canin, is that they help you with your puppies.
So I had a question because our first Eurasia, we brought him home with Royal Canin, and I was researching, and I was somebody somewhere may have told me this, but I thought there was like 2 formulations, one that was marketed in Canada and one was marketed in the United States. Is that true?
For
Royal Canin.
there might be some differences. There are some differences in the Royal Canin foods. Like we can't get their puppy formula here in the U.S. because there's an egg-based product in it, and they won't allow it to be over the border. So yes, there are definitely some differences in their food. They're based out of France, so they're a French-based company. And between the 3 big pet food companies, Hills, Royal Canin, and Royal Canin includes Waltham, Imes, Uterine, all that stuff. So Purina, Hills, and Royal Canin, that whole category, those are the 3 companies that do research on pet food. Everybody else is a Me Too. Everybody else looks at what their formulas are and they try to mimic it. But they're the only company that really pays for 3 companies that pay for research and development of new products. And so that's where all the veterinary prescription diets come from, is intestinal diet and heart diet and cancer diet and all these other things. Derm diet. Hills has a new dermatology diet for puppies that will reduce the likelihood that they develop allergies. I mean, there's some pretty cool research out there.
Would the nutrition be the same for like my Cocker Spaniel, who's also 3? She had her very first litter, which was 6 healthy puppies. There was no issues, and then after that it was split heats. She wouldn't go into heat. I brought her here one time when she was in heat, but then you even did it wasn't a viable heat. And then, she had finally went into heat again, and I'm like, well, we'll try. And then she bred, actually, but she had 2 puppies, just 2. And so, because she eats from as well, would it be the same for a Cocker as probably my Berner's issues with her fertility?
Yeah, I would look really hard at nutrition. So I was telling people earlier, I had a client that came in 2 or 3 weeks ago. We did a TCI for him. He's got little mini dachshunds, 10-pound dachshunds, so small ones he shows in AKC. And he came to us when he moved to Wisconsin a couple of years ago, and he said, Dr. Greer, I'm having problems with fertility. I said, well, what do you feed? Because that's usually my first question. What do you feed? And he told me, and I'm not going to tell you what he was feeding. I'm just going to tell you what it wasn't. And I said, switch to Purina. Just switch to Purina. And he came in 3 weeks ago for the TCI, and he said, I want to let you know that the same 3 girls that I had an average of 3 puppies per litter, I had 7.
Wow.
He went from 3 to 7. He said, I didn't change the environment. I didn't change heartworm. I didn't change flea and tick. I didn't add nutritional supplements. I did nothing other than switch from brand X to Purina Sport 3020. And these are 10-pound dogs. 7 puppies in a litter out of a 10-pound dog. Those are
That's
big litters. He's like, I am a believer. That's all he did. And you add to that these girls are now at least a year older than they were the last time they were bred, and he doubled his fertility.
Yeah.
So it's huge. You know, we assume that all dog foods are healthy,
Right.
and they're okay for a maintenance diet. But if you're looking at what they need for optimal fertility, it's a whole different game.
Right.
So can I ask a question?
Sure.
So you named the 2. So would you feed them all the time this, or you're
Yeah.
only feeding them
Absolutely.
when? Okay. So either one, the Purina Sport or the Royal Canin pregnancy.
Yeah,
it's
whatever. Well, the
constant?
pregnancy diet you feed during the heat cycle
First day.
until the 42nd day of pregnancy, and then you switch to the mother and baby dog or the puppy formula. So the pregnancy diet you only feed for pregnancy. The Sport 3020 you can feed all the time. And he said, because he has not just miniature dachshunds, but he also has a giant breed dog as well that's his livestock protection dog, not the same as yours. He said, I'm actually feeding less food, so it's saving me money.
Yeah.
So he said, I'm not spending more money on Purina, I'm saving money over what I was buying at brand X. So
we literally
wouldn't
cut
you
them
want
in half.
So it's better food, so they don't need as much, and then they don't poop as much.
Well, less
That's
waste.
true.
There's a plus.
Less
They
waste.
don't.
Less waste in
Yeah.
the food.
Yeah.
But we cut their amount in half.
Yeah.
Yeah.
One poor girl only gets 1/3 of a cup a day.
Yeah.
No,
That's not much food.
2/3.
Yeah, that's about what I eat too. Not much. Not what I used to.
Did you say it's important the Purina Pro Sport feed it to male and female breeding dogs? And then, but the pregnancy formula that from Royal Canin is only for the female,
Well,
correct?
actually, Rick Kessler that works at Royal Canin, I have been told, I haven't heard it from him directly, he's recommending that for the older male dog that's having fertility issues because it has some anti-inflammatory properties to the nutritional formula. So I think that's a pretty interesting look at it. So a number of years ago, we had a client that was coming in late in the day on a Friday afternoon for a semen collection and freeze. My staff looked at it and they rolled their eyes. They're like, "Oh, it's 4 o'clock. He's coming in for a semen freeze. We're going to be here late tonight." And I looked at it and I said, "Oh, he's 11 years old. He's probably going to have crummy semen. You'll probably be able to collect it, tell him that it's not working, send him home on some nutritional supplements, and have him come back in 3 months, and we'll check him again." They collected the semen, and they're like, "Oh my God, look, what is this?" Amazing semen. And I had a veterinarian from Texas that the same thing happened to us. She shipped us semen for our Labrador breeding. And I pulled the semen out of the box and looked at it, and I didn't call her and say, "Are you giving supplements?" I called her and said, "What do you feed and what supplements are you giving?" Because immediately, she's a field trial person, immediately I knew, looking at the semen quality on a dog that age, it had to be supplements. So yes, with the appropriate supplements and diet, it does make a difference on the boys as well.
Oh.
You gotta
So-
have good body condition to make good sperm.
I know you said in my case with my girl who's not wanting to eat, is it okay that she's been on puppy food at this point?
Oh yeah. Oh yeah.
Okay.
Yeah. The mother and baby dog is fine. The
Well,
puppy
she
is
won't
fine.
eat that.
Yeah. So
She won't touch the Royal Canin. She just wants the Purina puppy.
well, then let her eat Purina puppy. Food is better than no food, and
I know.
Purina's good food.
And I'm like, well, should I be feeding her the puppy?
Yes.
But then I go, but it's food.
Yeah. And
She's eating.
right, and if she's not taking in as much, it's more calorie dense diet to be on the,
So
the puppy. So
don't-
it's fine.
Don't wig out if all she eats is maybe a quarter cup a day.
What are you gonna do? If that's all she'll eat, that's all she'll eat.
Well, okay.
And a hot dog.
And she gets her a
And the
little bit
pheasant.
of hot dog.
And the
And
pheasant.
actually, she does get some lamb. She likes the lamb.
Oh,
She's
I
got it.
had Solvic on Royal Canin, but he throws it up all the time.
not
And-
everything agrees with him.
Yeah, and I tried him on the Purina Pro, and he throws it up. So I don't know what his deal is, but I feed him neutral, natural, and that he has no problem with.
Yeah.
So, because that's what I'm feeding my Anatolians.
Right.
And they only eat like 3 cups a day, and they're huge
Yeah.
dogs.
Does he throw
But-
up? Does he throw up like soon after he's done eating?
Well, he'll eat it up, and maybe a couple hours later, he throws it up just like it came right out of the dish.
Well, and that's because I was trying to. We had a cat that would just when you put food in the dish, it would just look, and then it would go
Yes.
and throw
Well, he
it
does the
back
same
up.
thing with the other food. He
And
gobbles it
and
up. But
our friend, who's the vet tech person, said to just spread it flat on a plate, and it took the cat
yeah,
longer to
it doesn't
eat it, and
matter
managed
how
to keep
whether
it
he
down.
eats
I'm
it
just
fast
saying.
or slow.
Yeah.
But should I be giving him some type of a supplement and see if he can keep that down? If I'm feeding him this neutral, natural
And
food.
fine, but he may have a food sensitivity. There may be something about one of those diets that it's just got something in it he's allergic. or
Because I know
sensitive
as
to.
long as he eats that, and I don't treat him when I'm training him.
Yeah.
Because he always throws up the
Yeah.
treats.
Yeah.
So
Yeah, but if you look at a lot of pet food, cat food, and dog food, if you drop it in water and look at how much it expands, you can understand if they gulp their food down fast and then they take a drink of water or
Yeah.
the fluid in the stomach, it just goes whoop,
yeah, but
and it
this
expands
doesn't
beyond
swell up.
capacity. Yeah, so it may just be that one agrees with him better, and if that's what it takes, then that's what it takes. But not everybody's
Because I was
the same.
feeding him half and half for a while,
Sure.
and he seemed to be okay, and then all of a sudden he started throwing. And it's always at night after we go to bed.
Of course.
He gets up
You
and
hear that?
blah, blah, blah,
Yeah.
blah.
Yeah, so it's
They
fun.
should
Shut
make
it
an
down
alarm
fast
clock
on
that
a dog
does
barking.
Because you get out of bed right away.
Yeah, exactly. Yeah, and then you can step in it in the dark. As you go. Where's the
And I
flashlight?
agree with what Dr. Greer is saying, because for about 2 years, I had one of my girls, and I mean explosive poop. Explosive diarrhea poop. And we tried every kind of digestive product, whether it was prescription or not. She might be good for a week, she might have been good for a month, and then we were right back at having this explosive diarrhea.
Well, I
And
had those problems.
So mine was the other end. And so I put her on the mother baby dog. She seemed to like it. Since we put her on that, we've had no problems. But why that food? I don't know, but we don't mess with it. And Dr. Greer's like, it shouldn't work that way, but don't change it.
Right, if it ain't broke, don't fix it.
So it was
Well, I
bad.
want him to be healthy.
Yeah.
You know, when we did the semen, he was
Yeah.
way above average,
Yes,
so
the
that
semen
was fine.
quality was fine. Yeah.
But I mean, I don't think it's a bad food.
Yeah. No, it's not bad. But if you're really looking at peak fertility for
Yeah,
your,
I know,
for your
but
bitches especially,
I got to keep it in him in order for it to work.
it's absolutely not.
How do you feel about like raw food?
Absolutely not.
No?
Hands down, absolutely not. And if you talk to most veterinarians that do reproduction, they're going to tell you that for 2 reasons. One is the bacteria and the parasites that are in it. You're going to end up with problems. We've seen more pyometras, we see more puppies with parasites, we see more problems with that. And then nutritionally, we see more dystocias, so more dogs with C-sections. Karen at Whelpwise can document
As a
that.
supplement. I don't feed it as a...
Yeah, but you're still putting raw into their food. So, not a fan. I've seen more pyometras with it. We've seen more nutritional issues.
Wow.
Just, if you want to feed it to all your other dogs and not the pregnant dog, that's fine. But if you go over to my other building and you ask any of my doctors what they think about raw, you're going to get a universal thumbs down on it.
You told me a story about raw, and you convinced me. It was the vet who was checking eyes.
Oh, yeah.
I stopped.
Yeah. So,
I was like, okay, I'm not going there.
So many years ago, I had Paul Miller, Dr. Miller from the vet school, do all my eye exams. He's close to retirement, so he doesn't want to do this eye clinic anymore. So we were in the room and we were running 2 exam tables at a time, pupils dilated in the dark, just like what you had today, back and forth, back and forth. And he started the exam on one of the dogs, and he looked in the retina, and he stepped back and he looked at the client in the dark, and he said, "How long have you been feeding raw meat?"
Oh my
I'm like,
God.
did he
And you
really
would
see
hear the
parasites?
air leave the room when she said, "How do you know I feed raw?" He said, "I can see the scars from the parasite migration through your dogs."
Oh my God.
So if that doesn't
Okay.
convince you,
There you
What were
have
they
it.
feeding?
I don't know. It was
raw.
probably 25
Right.
years ago. It was raw. But
Because
he
it
said
was-
he didn't say, are you feeding raw? He said, how long have you been feeding raw?
Do you think you
Just
get-
like the semen, not do you give supplements? What supplements do you give?
Right, right.
I can tell.
See, we've had a few Eurasia breeders that they won't even touch anything but raw, and I'm like,
I know. But I'd be
Fire
really
good.
interested in what their fertility looks like.
yeah.
Be really, yeah, fire good.
Hey, have you not seen the humans
I know.
who are having parasites in their bodies?
So do you think you'd get
Careful.
parasites from like raw chicken?
Oh yeah.
Oh yeah, most definitely. Chickens are disgusting,
Well,
dirty
wasn't it
birds.
one of your veterinarians that was in one of the speeches? I mean, I stopped doing that. I used to eat the raw hamburger. And she said in vet school she learned don't eat poop.
Yes.
Don't eat raw
Don't rub pus in your eye.
Oh my god. I don't know what made me finally right. Like,
Yeah, these are-
don't eat poop and don't eat raw meat. And I got it.
Yeah, and don't rub pus in your eye. Yes, these are some handy tips to have in life skills.
It was
Yeah.
like, you know, when you get really good hamburger and onion and pepper. I haven't done it. I don't know how many years ago that it was. It may have been during that French guy or whatever. I don't remember
It
where.
probably was. Yeah.
I haven't.
probably
So
him.
since then, I have not eaten that raw hamburger.
I do once a year. I
Right,
still
right.
break
That
down at
they will
Christmas.
do something to it so it is parasite free but still raw.
Yeah, they radiate it.
Yeah, they radiate it. That's the word I was looking for.
Okay.
Yeah, but it
It's
is
safer.
it is pretty tasty.
Yes, I like it too.
Oh, the raw hamburger with onion and the
Yeah.
pepper? Yeah.
Cannibal
I
sandwich.
still haven't done it since then.
Yeah,
You won't
only in
miss those
Wisconsin
once a
do
year.
you hear this.
That's true.
They don't have cannibal sandwiches.
It's
pretty
just,
much other
it was
places.
just a little bit. but
I like
yeah.
mine on
If you're gonna give
pumpernickel.
them beer,
Oh,
broth,
that would be good.
Instead of rye, you like pumpernickel.
Instead of rye.
What was the food that you were recommending? Like, because I came in a little bit late.
Either Purina Sport 3020
Okay.
or Royal Canin. So if any of you have young family members that aren't married yet, have them marry somebody named Mars, because Mars is the company that owns
Oh, yeah.
Royal Canin,
Right.
Whelping,
Or,
Make sure the
I'm
person's
Zuccanuba.
connected.
the Mars Bars Company, M&M's. It's
Nestle too, or something?
no,
right?
Nestle is
No.
Purina.
Oh, okay.
Mars is Royal Canin, Waltham Purina, or
Okay.
Waltham Royal Canin, and they own the Banfield Hospitals, they own the Blue Pearls, they own the DNA test Wisdom, MX. It's still a family-owned company. So if you have somebody that's looking for a future spouse, have them find somebody with the last name Mars. I told my kids to do that.
I think if I find somebody, I'm going to like ditch my existing spouse.
Well, yeah, you can always come back and marry him later.
That's right.
Just don't sign a prenup. You've got it, Sue. That's the way to do it.
Okay, well, since we're on that thing, if I fill out an application, how much of my work over there free?
Discounted, not free. Yes, it is discounted. Are you filling out an application?
Oh,
You should.
yeah, that's his.
As often as you're
Wow.
here, yeah.
That's
She's the waitress, and it's taken its toll on her. She needs to have something that's not.
He watches me kind of fall out of bed after I worked a few nights in a row that have been really, really long.
Are you working on concrete?
Yeah, with 40-pound trays on one shoulder.
That's
I ain't getting any younger.
That's got to be good on the back.
It's not the back that hurts; it's literally the feet and the
the
hips.
feet and
And the hips.
varicose veins. You'll have them if you work on concrete in your life.
Hi.
Yeah, it's not good for you.
No,
She does. She does. Well, she has,
I'm gonna.
she has shoes with springs. in
Thank
them.
you for that.
Yeah, thanks for stopping.
I'll see you soon.
Okay.
Thank
Yeah,
you.
I'm
You-
sitting
I-
here
I just wanna
procrastinating
com-
too. I should be
I
at
just
home.
like to
Well,
compliment
yesterday, you wouldn't have done it yesterday because it was nice out yesterday.
your staff. I mean, I can't believe how organized it was in there. Absolutely
Katie's got it,
fabulous.
doesn't she?
And I
guess we
love
should
Dr.
sign up
King.
for that.
Yeah,
Very great.
Yeah, he's
Love
great.
seeing you.
For health testing.
Good, well, thanks for coming in.
Thank you very
No,
much.
it's my grandson's birthday today, and I was supposed to get home in order to go to and no, I had to talk with Dream because she wasn't due to come and meet until the beginning of November. And I told her, okay, we're getting in the car, we're driving to Chattanooga, we're going to spend 5 days visiting our great granddaughter. You cannot come in heat
She had
early.
one. She had one over at the
She didn't.
Posey's
We got home
restaurant too.
the first night
She had a couple at the
home.
library.
She got up on the bed, Sobek jumped up on the bed, sniffed where she had sat, and peed all over the bed. So here I am midnight, carrying all the bedding off,
That's never happened to anyone.
cleaning the bed. But she came and he that night, the night we got home. So she listened to me.
So, what other questions do you have?
Thank
so, I
you.
showed each of you one of the books that we sell. So, those are pretty great reference materials.
Oh my God, I reference it every litter. I'm already reading up.
That's a fantastic,
Yes.
fantastic
Yes.
reference point.
So I have a question about dental care.
Yes.
So I have a lot of dogs, and there's no way I'm going to brush every single dog's teeth every day.
I know.
So what is the best? I mean, knowing that like I'm just not going to do that.
Right.
So
There's a really good product on the market called Teef, T-E-E-F.
okay.
So instead of T-E-E-T-H, it's T-E-E-F. Is made by a PhD biochemist, or I think microbiologist, I think is what she is. And what it does is it establishes the correct bacteria in the oral cavity. So it significantly reduces. You can buy it from their website. You can buy it on, I think you can get it on Amazon.
Okay.
Good product. And of course, chewies, chew things are always good too, like the greenies. Those are good too, but those sometimes will lead to dog fights and other, if it's high value. Sometimes you'll end up with a scuffle over those, so you kind of have to be careful with those. But the greenies of the past that we were concerned about when they first came to market, they've improved them.
Okay.
So I would do something like that. And you're right, it's pretty much impossible when you have a dozen dogs to brush everybody's teeth every day.
I only have half a dozen,
Sometimes,
but still a lot.
Sometimes just getting them fed.
Yeah, it's
in and out of the house and
yes.
fed often enough to make everybody happy can be a challenge. So, no, I completely understand.
Greenies were at first. The greenies were not that good at first.
At first, there were concerns with bowel obstructions, but I think they've improved the product quite a bit. Yeah. So, and there's a lot of dental care products on the market.
Yeah,
now.
the Orthovet.
I've been using them.
Yeah.
Those are pretty good.
Yeah.
And then the canine dentists up in Oshkosh recommend the CET bareback chews.
Right.
Yeah, that's
right.
what I've
Those
been
are really
using.
good. Those have an enzyme in them that help break down the tartar. So the
They're
CET.
CET bareback, BIRBAC chews. You can get those at PetSmart.
Yeah, so they've got a toothpaste and they've got an enzyme. The same enzyme that's in the toothpaste is in the chews. And they make them different sizes, so little dogs get little ones and big dogs get big ones. You could never go wrong with getting a bigger chew.
Right.
You could always go wrong with getting too small a chew and having a gag on it. So if in doubt, size up.
Yes, and I get the larger ones and then I'll cut them in half.
And then, like I said, the high value items, sometimes you'll have fights in your house if you have dogs that are possessive. But
What do you think about bully sticks?
what kind of sticks?
Bully sticks?
Like real bone?
No,
bully.
bully.
Oh, bully sticks? You know what those are?
Yeah.
Yeah.
Have you smelled one of them? They smell terrible.
There's an odorless kind.
No worse than water buffalo horns.
Yeah.
Speaking of that, do you want anything to eat? Do you want anything to bring anything?
Not right now.
Okay.
Thanks. Hooves, remember when hooves were the big thing?
Water buffaloes?
The hooves
The
that
house.
oh,
They
they
suck
come-
them in.
You wake up in the middle of the night and it would smell like something died in your house because the
You're
dog
looking
had
on
chewed
the
into
floor
the
for where it,
all those layers of. It's like eating chicken feet in your chicken soup. I just can't do it. All those years of manure layered into the hoof just seems like such a terrible idea.
But they're so tasty, especially
they
fresh
are.
off the
They like fresh manure. Don't think they don't like old manure.
Oh, I know. Old manure is even tastier. But the concern with some of these products are, there's bacteria, there's bowel obstructions. They can break their teeth. The elk antlers, they wear teeth down.
Oh,
Just terribly. So we see dogs coming in with little nubbins of teeth left. So I'm pretty careful not to do those. The round bones, that's always my favorite. Everybody knows about the round bone thing, right? That comes out of the round steak. How they flip on and they get caught on the lower jaw. Yeah.
No idea.
Yeah.
Now, why don't you like antlers? That's
They wear down their teeth.
Oh, I give antlers all the time.
The elk
Do you?
antlers. Yeah, but
You might have to
moose
limit.
antlers we have are a lot softer.
Yes. Yeah. The elk antlers
The
are
elk antlers are the ones that we're on.
the tough ones.
Moose antlers is softer.
Yeah.
Yeah.
Do they
Moose
sell
antlers
such a
are
product?
softer.
They must.
Yeah, well, at some dog shows we've seen people there, and they'll just have basically they cut them up. You don't get the whole.
Yeah.
You're walking around with the
You
whole
can
thing.
get like a button, which is like a cross. You can
Yeah.
get it's sliced so that you get the marrow in the middle. But I just get literally pieces of antler because my dogs like that normally anyways, and it's got nutrients in it because it's got the, what is it, keratin, same as your fingernails?
Yeah.
Yeah.
My only question is on the water buffalo horns, how is that sustainable?
Doesn't seem that way, does it?
No.
Oh, you mean cutting up those water buffalo horns? I wondered that too.
Like, how many water buffalo in the world were sacrificed for that?
Yeah, because I've got like 17 water buffalo horns laying all around the house.
Yeah, it does kind of worry you. Yeah.
Because they don't continue to grow them, do they?
I don't believe so. It's not, And
I think it's harvested as part of the slaughter process.
Right, but how many water buffalo can you slaughter without losing your population numbers?
Right.
Yeah. Yeah, so that's where some of those, what is it, yak cheese, what are those,
Oh, yeah.
the Himalayan
The Himalayan, but my kids all get diarrhea very badly from those.
Do they? Yeah, so you've got to be careful with some of that. And high value things, I will have dog fights at my house if
So we
two dogs get those.
create our dogs, for bed and stuff like that, and that's their den.
Right.
And so when it comes to the high value chews, like we have nylon bones and you're just laying all over the floor, but when it comes to the horns, then it's like that goes in the crate.
Right, and you only get
you
into
get to
the
have
crate,
that for 5-10 minutes,
Right.
and then they come out and they go away.
Right, and by limiting the amount of time you let them have them, you're probably restricting the amount of damage done to the teeth. They'll also break the carnasal tooth, which is the fourth upper premolar, when they chew on things that are too hard. That's the most likely tooth to fracture, and it's got 3 roots on it. It's the only tooth that a dog has that has 3 roots. If they break another tooth, it's going to get loose and come out, but that 3-root tooth is the one that gets a slab fracture or fracture off the side, and then it'll abscess, in some cases, below the eye. I don't take them out unless they're abscessed, but there are a lot of veterinary clinics that are like, oh, it's broken, it has to come out. I'm like, oh, it's a pretty major structural tooth as far as I'm concerned in the face of the dog. The canines and that carnasal tooth, it looks like a molar, but it's actually a premolar. It's that big molar at the back. I worry about taking those out unless they absolutely have to come out because they've abscessed. So I'll tend to leave them because.
Interesting. Okay.
Yeah, that's my personal opinion of what to do with a broken tooth. May not be necessarily shared by everybody. So, and there's a lot of water additives, but I think the teeth product is probably the best one on the market from what I've read and seen. I think that's the best product.
Is that sprinkled in their food, or what is it?
I think it's a water additive.
Water additive? Okay.
Yeah. So TEEF. Then it has an exclamation point behind it.
Okay. Yeah, I wrote TEEF, exclamation point.
Other questions? So we scared all of you newbies away from ever wanting to breed? With all of us old folks around here that have been breeding forever?
It's an adventure, I'm sure.
We're kind of in the middle because we had our first breed.
It's quick learning.
Yeah.
It's a sharp curve.
Yeah.
Well, and so ours was the pandemic puppies. So the restaurant closed down, so she was home all the time with them. So that kind of worked out pretty well.
So what can you tell us about Singletons?
Pawn those off as fast as possible.
Yes,
Really?
find another bitch that wants to take on a puppy. Singletons are a challenge. A couple things happen. One is they're frequently C-section puppies because the bitches don't go into labor with a single puppy, and because labor is induced by the puppy, not by the bitch, and they can end up being pretty big or just really delayed in delivery. So number one, they're often C-sections. Number two, they don't have puppies up against them that are bumping around and challenging them for a nipple spot, and so they don't get the sensation of being frustrated, being pushed around, being touched. So if you don't mess with them adequately, you have to really handle those puppies a lot, more than just your average early neurological stimulation puppy stuff. You need to take a stuffed animal several times a day and push them off the nipple. You need to hold them. You need to frustrate them. You need to teach them some things that they're not going to learn as a singleton because you're just like, oh, it's such a nice little baby. Let's just leave it alone. No. You got to do something with it. If you can graft it onto another litter, that's helpful, but sometimes you can, sometimes you can't. So handle them a lot, and then just be aware that they're going to be different. They're going to be spoiled. They're going to be brats. I can tell who they are, but I can also tell when people come in with a child in their family. Be like, oh, is this your only child? And they go, oh, how can you tell? Oh. Because they're different. When my daughter was in junior high, she looked at me one night at dinner and she said, "Why did you have to have him?" referring to her younger brother. And I said, "Because you would have been a brat without it." She's like, ugh. She thought she was only going to have one kid. Now she has two, thank God. So kids should be raised in bunches, not as singletons. So you have to be careful with getting them handled enough and making sure that they understand frustration, they understand touch. The other thing is sometimes they are really, really fat, and sometimes they're really, really thin, depending on whether mom decided to lactate enough for a litter of puppies, or if she's like, not enough stimulation, just going to shut down. So sometimes you have to do a lot more hand feeding with them. Sometimes you do, sometimes you don't.
I have really, really fat right now. Yeah. She's over 3 pounds.
Yeah, and a lot of times too, what I'll do is I'll take an old sock or an old some kind of tube and fill it with either rice or beans, and then I'll prop those up on each side of the puppy, because puppies, when they nurse, they hold on with suction, but they have each other to kind of stack up like cordwood. And when they're the only puppy that's attached, it's a lot harder for them to stay attached. So they use a lot of energy just holding on. So I'll take those bean or rice filled socks and microwave them and then prop them up against the puppy so that they don't roll back and forth when they're trying to nurse. So I have good luck with that. So those socks that you have in the drawer that you're not sure what to do because you don't have a mate for it, I now have a home for them, as long as they don't have a hole in them. If they have a hole in them, they won't hold the rice very well. So those are the things I recommend for singletons, is just extra handling. You all know about Carmen Battaglia's early neurological stimulation, right? If we know that? Yes.
I think we did that.
Yeah, the 5 steps. So it's 5 steps. And you can do it in any order. It's in the book. So you can do it in any order, but it's 5 steps. You start on day 3, you go to day 16, and it takes you about 30 seconds a puppy. So step 1 is hold them head up for 5 seconds. Step 2 is hold them head down for 5 seconds. Step 3 is on their back for 5 seconds. Step 4 is tickle the bottom of their foot with a Q-tip. And step 5 is put them on a cold towel. My husband uses a Mountain Dew can because that's what he usually has with him. So he'll just lay it on the can for 5 seconds. And that really helps a lot with that social skill and the handling. They're better able to handle stress and other things. So that was started during the World War. And if I were sitting in a foxhole with a dog as my only companion and my only help during a World War, in those situations, I would want that dog to be stress-free. So it does reduce stress and anxiety in a lot of the dogs. And the people that I did not do it with my first litter of farm dogs, shame on me, because I know better. They were different than the puppies that I've handled since. I just didn't, because things were going great and I didn't mess with them. Usually my corgis, I'm tube feeding, I'm messing around with them, I'm always handling them. The farm dogs were just good. So I saw the difference.
Have you looked at Puppy Culture, Avid Dog, and Badass Breeder now?
A little bit on each, not in depth on any, but they're all pretty comparable with just good social skills and good handling and
Okay,
yes.
So you don't have a preference for any?
Not really. 100 experiences in 100 days, kind of the same thing. Sophia Yin, Ian Dunbar, they've all talked about social skills for a long time, and there's just a lot of fun things you can do with them. Just getting them handled a lot, getting them out. And it was tough during COVID because people weren't letting people into their kennels. They couldn't take them places. So I've done things like Walmart. If you go to Walmart on any given day, you can buy 11 styles of bath mat. This is just a little bit of trivia for those of you who don't shop at Walmart. You can buy 11 styles of bath mat. They can be bristly, they can be shiny, they can be dark, they can be light, they can have round holes, they can have square holes, they can have slats, they can have mesh, and they're great because then the puppies can be on 11 different surfaces without ever leaving your house.
Textile.
You just switch them out. You can throw them in the washing machine except for the slatted ones, they don't go in the washer very well. Throw them in the wash, hang them to dry, boom, they're clean. So you've got different surfaces. It lets the urine drain through, but it gives the puppies different textures that they walk on. You've all seen those things built online now that people are building out of the PVC tubing in the toys.
Yeah.
I'll put up a full-length mirror on its side so they can look at each other. I bought a rabbit hutch, the kind that have 2 stories and little doors and they can go up and down. So I bought a rabbit hutch. They chew on it a little bit, but they're sitting on the roof of this rabbit hutch. So they're sitting up this high, looking out the window, leaping off, doing all the things they shouldn't be doing. I've done lots of things with fruits and vegetables too. So other than grapes, raisins, and the starchy veggies, I'll give them fruits and vegetables. I'll vary it up. So they have cantaloupe one day and they'll have green beans another, and it just gives them all these new textural and kind of sensory experiences. I'm really bad. I'll go to garage sales, or if I drive down the street and I see somebody has like their kids' toys out at the curb and they're just throwing them away, I just pull over and throw them in my car, drive away really fast before somebody looks at me like, "What are they doing?" The little
lawnmowers.
The lawnmowers and the little popcorn poppers and the wagons and I got a bowling ball set, and just all these fun things. The little piano that makes noise. There's one sitting on my kitchen floor right now that when you step on it, you're like, oh yeah, I forgot to put it there. So all those things that you can do. There's a wiggle ball that's really fun. I had to buy one of those. It was $10. That does all these fun things.
Noises, doesn't it?
Yeah,
right.
Yeah, they hit different things, and it rolls around and it rolls randomly. It's meant for toddlers that are 6 to 24 months old. It's this great little toy. So all those things you can do. A wading pool with ducks that float in it those are really fun.
Did you do a ball pit?
Yeah, I have done a ball pit, and I've been down to the class that Katie Olschlager teaches. Down
Positive.
Right.
She's in Waukesha.
Yeah, Waukesha, New Berlin, right in that corner of the city. So there's lots of really fun stuff you can do. You can go to her class once and then come home and do it, yourself.
The other thing is she will also let you bring in a litter of puppies. Mm-hmm. It's a little over $100, but for an hour, your puppies get to play with all of her crap in her big room.
Mm-hmm. And the ball pit is really fun. So there's
it was not that much fun.
Oh, you didn't like it?
They chewed out every single ball.
Yeah, well,
they destroyed every ball.
They're cheap. I need to throw the ball away. Yeah. You buy a big box of them.
But I'm like, please don't eat that.
So
we found a little like slide.
Yes.
And as they got bigger, they were on that. They were sliding.
Oh yeah.
We have like the tunnels, and my father-in-law is an excavating guy, and I hit that all the different size tubes.
Yes.
That was like it was a jackpot.
Yeah, I've got one that's Y-shaped, and I've had corgi puppies with one side,
right,
one end, and one in the other. And it looks like this puppy has this weird angle, and it's like this long because you've got two puppies in the end, and it looks like it's
right. I have the
So mentioning the puppy culture, because I have Jack Russells and they're notorious for running away.
Yeah, ours too.
Yes.
I start at a month or 4 weeks of age, so a month old, teaching them a recall with treats, whistling. I whistle 3 times.
I do the Pavlov when I feed them. Puppy, 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 put the bowl down. Puppy, 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 put the bowl down. I go outside and, we take them out for a walk. Puppy, puppy, puppy. Bam, they're there. Somebody told me it was a circus trick. Because I'm like, just say puppy, puppy, puppy.
So when I whistle 3 times,
there you go.
By the time they go home at 10 weeks, they have a pretty basic recall. And I had one puppy buyer go home with her puppy, and that's all the family did that whole night, was whistle for the puppy to come. They thought that was the coolest thing in the world.
And that doesn't fade, because about age 2, our recall completely fades and is completely non-existent.
That's the old be the bunny.
With food, though.
We try with steak in our hand and chasing her for over 8 hours.
Yes.
Every time,
but you're too far gone by then.
Every time they're fed, it's a whistle. When you're outside, you whistle.
I just whistle. Mine comes. If I whistle once and I don't hear them running, I whistle again, and then one out of 2 will be running.
Yeah, mine don't give
anything. I don't give me anything.
So I start literally at 4 weeks of age with Braunschweiger sitting on the floor.
I will have to do that because literally ours are known not to have recall. Yeah. They wear battery packs in Norway because they know they're not coming back.
Yeah, and it is hard to reinforce that. But if you're going to do agility, if you're going to do some of those sports, you've got to have a recall. So
I have an older girl that I did take multiple recall classes with, and she's one that goes, well, that was one whistle, so that wasn't for me. I'm going to wait for the second whistle. And then she goes, oh, well, that's a second whistle. Well, still not for me. She waits till the third whistle before she comes. But she hauls her ass when she hears the third whistle.
I just always think to myself, the Borzoi had no recall when I had them, and the Elkhorn had no recall when I had them.
They're all hounds, my dear. Do you hear that? Do you hear that word hound at the end of everything you say?
I don't like a golden retriever.
Well, then you don't go to get.
There's no
You're not going to get a golden retriever.
The border collie was easy.
Yeah, everyone.
The border collie was insane. She was awesome. I'm like, oh my god, I think you're smarter than your mother.
Could be. So who in the room has litter box trained their puppies? Have you done it? Isn't that amazing?
With the paint first.
Isn't that amazing?
That was nice.
You get a paint roller tray. You bend the legs so that one end's down, then they can get in there really easy.
And we started that at what, 10 days?
But wait a minute.
7 days.
How do you do what we use a different? So tell us how you do
use
that.
The cat box.
So you get
Oh no, we can't introduce cat boxes. I have 5 of those in the house.
roller
I have
trays.
Yeah.
You know?
So
Yes.
You
I
bend
have
the
cat
legs
doors
out
in the
so that
bathroom
So
doors.
it's this short
The
on
litter
one
boxes
and
are
this
in
tall
both
on the other.
bathrooms.
Okay.
So those are stayed.
so that the puppies
And
can
if
easily
they
get in it.
accidentally
Okay.
leave the door
They learn how to
open
go
on the
into
biggie,
there
they
and
can pee in the
just
litter
put
box.
newspapers
Because the
in there.
Borzoi did that once.
I use the paint pan liners that are 3
Yeah.
for $1.88.
Oh yeah.
And then I put in wood pellets, the horse bedding wood pellets. What do you use for
Yeah.
substrates?
You
You
mean
use
like
them
our,
bunny
you mean our shavings like that we get for our real horses, or
But
you
yes.
mean?
Wood pellets.
But then
As long as they're not
pellets.
cedar.
Oh, the
Sorry.
ones that we use.
But if
for
they go to the litter
salon.
box,
Like the
then
alfalfa
they're
pellets.
housebreaking.
Not well.
Or you
If
do
they're
it a little
just on a
smaller,
tray,
yeah.
then it's
Yes.
Oh no,
okay.
for their like litter
Yeah.
box, I use
Yeah.
it's like it was at Farm and Fleet, like the bunny
Yeah.
thing.
Now, see, you have corgis, so corgis' legs don't get over the side
Oh,
of the
yeah.
tray. It's too high for them, so that's why the paint pan.
So I
Came in
just
handy.
cut down the disposable kind of paper mache cat litter boxes, and you can get 3 of those pretty reasonable.
Yeah, when they get icky, you throw them out.
You just throw them out, but I mean, it's so easy to clean up after them
Yeah.
doing that versus, you know, and I
All
mean,
over.
there are people that complain about, you know, if they get tearing around and, you know, you have pellets all over the place, but I'm like, I'd rather vacuum pellets up than be picking up
Poop
poop
everywhere.
everywhere.
Yeah, we had a litter of Dobermans in on Thursday for ear crops. You know how much 6-week-old Dobermans poop?
Yeah. A lot.
Oh man, it's a lot, and they're there for 8 hours. It's a lot.
Yeah,
That's
I
a
raised
lot.
my litter in the living room.
Mm-hmm. Yeah.
I didn't know if I'd ever get that smell back.
Yeah. So yeah, once you've litter box trained a puppy, I mean, I've been at some of the revival things, and some of the whole conversation has come down to people that have never done it and people that have, and the people that have never done it are like, what? You can litter box train? So
It was awesome. When you told me that, I was like, okay.
yeah, you thought I was crazy, didn't you?
But I followed everything you said.
Well, that's remarkable.
So how does that transition them then to going potty outside?
Then you can take the substrate, whatever it is, pellets, newspapers, whatever, out into the yard, in the part of the yard you want them to go in, and they know that that's what they're supposed to do. So whether there's snow or grass or whatever, they find that area.
And it's you know, if it's the wood pellets, they just disintegrate basically. And so the other thing I do is in my whelping pen, I put my litter box next to the door. Downstairs where it goes outside, I have 2 litter boxes next to the door. And I have, till this day, I have a 2-year-old girl, or she'll be 2 in December, that if she can't make it outside, she uses the litter box. You can't yell at her.
No, you can't.
Because she's not messing on your carpet.
Right.
I've had some of my adult dogs that I've raised as puppies go to the litter box in the middle of the night when they have babies and use it.
Yes.
And I know it's them because it's a big old stool in there. I'm like, that did not come out of one of the babies. Now, the dogs that I've purchased and brought into my home that weren't litter box trained don't do that. But I've had it happen twice where home-raised dogs have gone in the box and there it is. So yeah, it's a pretty great, talk about a party trick. It's a pretty great party trick to have a litter box trained dog.
Yeah, and then I have one girl who actually teaches her puppies to use it.
Ooh, that's nice. How'd you get that to happen?
That's Feathered.
Oh, is that right?
Yeah, Feathered will go in the potty pan and go potty, and then next thing you know, all the babies are in the potty pan going, "What are you doing, Mom?"
Oh, and then Mom teaches them to go in there.
Oh, cool.
Yeah.
Very cool.
Mom teaches them how to use the doggy door too,
Mm-hmm.
as the rest of the pack. That's awesome.
I mean, she's actually a really good mom.
Yeah, that's fun. What other questions? Other things you want to talk about?
How much is your book?
It's 90.
90.
Do you still have a pandemic puppy one? Are you going to come up with something close to like Avid Dog and puppy culture and badass breeder?
When I get there. Okay.
No pressure.
Yeah, nothing else to do.
In her spare time.
Yeah.
After a part-time job.
She has so much time, I'm sure.
Yeah, the 3 jobs that I have, it's plenty. But I'll eventually get there.
Do you have a retirement date? I hope not.
Are you kidding? Why would I retire?
Okay.
That
She
sounds
said-
horrible.
She loves what she
I
does.
heard she's at least another 10 years is what I heard.
Oh yeah.
Because that's all we have is left is this 10. So
Well,
can you go 10?
So last November we went to a concert, Asleep at the Wheel. Everybody know Asleep at the Wheel? It's a pretty
No.
small group. It's kind of Texas swing, kind of off the beaten path stuff. So we went to this concert. Long story about how we got there, but they sang a song that they were going to sing during the pandemic for their 50th anniversary called Half a Hundred Years. So we were at the concert and I said to Dan, half a 100 years. We're 40 in. We got 10 to go. So half a 100 years. So no, I'm not
I know that
retiring.
song.
Yeah.
Yeah.
Yeah, it's a good one. So no, we're not looking at a retirement date any sooner than half a 100 years, which is 9 more years from now. Well, we've owned the practice for 40 years. We've been in practice 41. So we got some time to go yet.
And you haven't killed him yet.
Isn't
You're
that
gonna write a book on
remarkable?
that.
Yeah.
He's a cat.
Working with your
He has
spouse
9 lives.
24/7.
Oh yeah. There's moments that it goes really well, and other moments you're like, really? Like yesterday, loading furniture into the van. Never load furniture with your spouse.
And you were
it's
moving all the chairs, or what were you doing?
No, our daughter bought an item off of Facebook Marketplace in Indiana. So we hauled it back from Indiana, put it in the garage, put it back in the car yesterday, take it over to Marshfield. So yeah.
So, question. Because they teach so little in reproduction, is it eventually going to become a specialty?
It
Well,
is.
it is a
It
specialty.
is.
I think it is.
There is theriogenology.
But not taught at UW.
No, and they don't have a theriogenologist on staff at UW, which is why I was blessed to teach it last year to the vet students. I didn't teach any large animal, I just taught the small animal. If you go to Auburn, they have 10 theriogenologists on staff at the vet school there.
Mm-hmm.
Wisconsin has 0.
Right.
It seems that in the dairy state we should have
Something.
something. Yeah. So it is difficult, it is frustrating, and like I said before, if anybody wants to foster a veterinary student, I will hook you up with one who's interested in coming and hanging out with you and seeing what your performance is like and what your grooming is like and how hard you work. And, because people are under the impression that you just, like, cha-ching, you just have a litter of puppies and money comes rolling in and it's super easy. And yeah, so the students need to see that there's a whole different side to it.
You make money on puppies? Did I miss that?
Well, there are people that
somewhere?
do. There are people that do.
So if you did foster a veterinary student, what would that look like? They would stay at your house?
They could,
Okay.
if you were going to have a litter of puppies and you wanted them to stay a day or two so that they wouldn't miss the whelping in the middle of the night. Yeah, you could have them meet you at dog events. So if you wanted to take them to a field trial event or Earth Dog or whatever event you go to, yeah, you definitely could. And there are vet students that are interested in doing that. I get a
Wonderful.
chance. Yeah, I get a chance to speak to the vet students at least once a year. And so if you're interested in that, we can hook you up. One of our Labrador breeders had a student that stayed with us when the year that Theriogenology had their conference in Milwaukee. I had clients that took in students because it saved them money on hotel rooms. And so one of them is a Labrador breeder, and she got invited to the girl's wedding. I mean, they became fast friends.
Yeah.
So there's definitely students that are interested in that kind of relationship. And then there's others who think that dog breeders are horrible people and they don't want anything to do with you. So it's not for every student, but there are definitely students that have an interest in it and would be great to mentor. That want to breed dogs, want to raise dogs, want performance dogs, want the predictability of purebred dogs. So yes, I think it'd be really great to be able to do that. So if you're interested, let me know. One of our clients actually came up with the idea of us doing that. She's a retired physician and raises setters.
So yeah, I would definitely do that because so many veterinarians, they have no idea that there's this whole other side of
Or they don't like us.
dog people, right? They don't, well, because they don't know.
Right.
It's just
They think you're horrible people, but they don't know.
Right.
They don't know how much work there is. You know, they don't. I show pictures of like how big does your van have to be, and how big does your yard have to be, and you know all the things that go with being a breeder. It's not just you know
The
it's not
things
just
you actually don't think of, because
Right.
you have slowly
You've
gotten
just
to that
always
point.
done it.
right. And you know you've always stopped at the curb and picked up the toys.
Right.
You've always dumpster dive for whatever litter you're having next.
Yeah, you know people think that's normal. It probably isn't.
Or even just for somebody to see like the amount of time you spend training and you know taking care of the adult dogs.
Grooming, preparing
Right.
for the ring.
Or just the whole from the beginning with breeding to what it takes to get to having the litter.
Right. Selecting.
I mean,
the
how
meat,
much
right,
time
all the
do you
things.
spend trying to feed them?
Right.
Playing, would you eat this?
Right.
You know?
Disappointments of the litters not showing up.
Right.
Or having prospects that did not measure up to what you wanted.
Right.
People don't include all of that.
Yeah.
I never understood the phrase, you have to have a strong heart to be a breeder.
It's true.
Because it hurts.
It is true.
Yes.
I mean, I've had a lot of weird things happen.
Yes, breeding is not for the faint of heart.
No.
It's like anything in life, though. There's both sides of the coin there. And it can happen anytime, and you just got to be ready to roll with it. That's,
Yeah, it doesn't matter what it is. If it's your job or your kids or whatever, it's work.
I mean,
So what is your breed?
Nova Scotia duck-toning retrievers.
That's a big mouthful.
Yeah.
Tollers.
Tollers.
Yeah, the first time they told me about Nova Scotia duck-toning retrievers and that Big Sue had them, I looked at them and said, "Are you making this breed up?" Like, what is that? Because my dad...
Do they not teach you breeds and...
Well, it was a relatively new breed.
It was a long
I was,
time ago.
Yeah,
It
it
was
was a long
okay.
time ago.
30-some years ago.
Yeah. But my dad, my dad wanted a Scottish Deerhound for years, so he finally got one, and he would walk the dog around, and people would say to him, "What kind of dog is that?" And he said, "It's a Michigan Moose Muncher." Dad, people are going to believe you.
Yeah.
And they'd go, "Oh yeah, I've heard of that." No, you haven't. He totally made that up. So, you know, Danish Swedish farm dog, Nova Scotia duck-toning retriever, they look at you like, really? Like, are you sure that's a breed? Yeah, well, they couldn't decide if it was Denmark or Sweden, so they shared it.
Right.
Yeah. So, absolutely.
I get all the time, it's a Husky Shepherd mixed.
so do we.
No.
So do we.
No.
But they
How
think
could
corgis
you-
are a beagle cross, and they think farm dogs are a beagle cross. I'm like, does it even look like a beagle?
Right, it does.
Doesn't look like a hound at all, it looks like a terrier to me.
My
Original.
Emma, people think that she looks like a
Original.
beagle, and I'm like,
I never get that with my own, ever.
It's surprising what they say. They ask
so
about.
has anybody put anything like on, I mean, if your website or if you have a Facebook page or anything that says the perspective of a breeder of, you know, this is my perspective as a breeder, what helps get you the puppy you want.
So one of the farm dog people has on her website, "My puppies are free, but you're paying me $2,500 for importing the stud dog, importing the bitch,
Oh, that's
doing the
funny.
health clearances, raising the dogs, selecting the right breeding care, feeding the dogs, all the aspects that go with it." She puts that out there. I'm like, yeah, that's
awesome.
pretty smart.
We need
See,
something
that's
like that.
what I want it to do, but I'm hesitant to do it because I'm worried that people are going to be like,
They
but
don't
that's
get
what,
it?
yeah.
Yeah.
Or it's,
But
well,
if they-
that's what you're supposed to do.
If they don't get it, are they really the right person for your breed?
Right.
Right.
No.
So
And
if
then you
offended
write in there
somebody-
for a whopping $10 an hour.
10.
Yeah, if
You
you're
get
if,
10,
if
I
you're
think I
lucky.
get
It's more
5.
like 10 cents.
Because they don't know how much work you put into socializing them and the materials of the books and the reading and all the education that you've provided for yourself to get the right breeding pair, to get the right socialization. They people just, like I said, they think
don't
puppies
think about
just
it and they
fall out
don't
and then,
really care.
and then money rolls in. Some do. And those are the people you
Yes.
care to
Yes.
sell puppies to, are the people who do care. And if they don't care, you know what? That's fine. Go get a rescue. I'm okay with that.
Yes.
But if you're committed to this, then that's the way it works.
So how many people in the room get inquiries and then they kind of drop off the face of the earth? And then you get inquiries a year or two later from the same person that doesn't realize that they inquired a year or two.
My text doesn't lose them. And then I'm like, you just asked me 6 months, 2 years ago, we're on the same questions. So yeah, I think that's a part of.
So, you know,
sadly,
it's kind of like, I answered these questions 6 months ago.
One guy was like, "What makes your puppy so special?" When I told him the price, he's like, "I'll circle back," and then he did, and I just didn't answer. Like a month later.
Yeah, it's kind of like an automatic no at that point.
Yeah.
So do you? Because there is one guy that I recently and everybody tells me go with your gut.
Mm-hmm.
Do that.
Do you want a 15-year relationship with this person?
Mm-hmm. And the reason is his Facebook name is Travis Facebook. And I'm like, I think this is a scam.
I would just run.
Somebody made
Just
that up
don't
real
even.
quick.
Yeah.
So I did send him in a copy of the application, and he filled it out. And some of his answers were kind of interesting, like, "Do you have kids?" And his reply was, "Hell no."
Oh, well, I would have followed that up with, then are you sure that you are have you followed the proper procedures to make sure you didn't bring any into this world?
Well, you know, and I said to my other half, take.
Should be mandatory.
I just said, review these applications, tell me what you think, because my gut says no, because I think he's a scammer. Mm-hmm. So has anybody encountered something?
I encountered one scammer and one stalker.
Oh,
nice. No, if you don't trust if your instincts tell you that it's not the right person,
they want your address,
then you don't want to do it.
As soon as you don't trust them, if you do sell them a dog, or if they do come to look at a dog, you already don't trust them. So it's the relationship is.
And it's a relationship you're going to maintain for 15
it's like
years
you're
at
doing
least.
for a career. You're not going to want to join
I
in a career
see all of my
with somebody
puppies,
if
and we
you
have a
don't-
private
no.
puppy page.
No.
and my reply generally is to these people is, I just don't feel we're a fit for what you're looking for.
I just say, I won't have anything for you.
Mm-hmm.
My question is, where do you guys advertise?
I don't.
I don't either. Mine was word of mouth only, but then I had the last one, Jonah, who was supposed to not be with us and is with us. They were Chicago. He was a detective and she was a criminologist.
Wow.
And I did all of their search. I Googled, their house was gorgeous, whole 9 yards. They ghosted me. 4 months later, she emails me. You probably don't want to hear from me, but does Jonah have a home?
Yes.
I'm like, yes, he does. My husband will not let him go. But we ended up with keeping 2, which was really not on my agenda.
Yeah, and things go kind of hot and cold. For a while, the puppy market was really, really fast. Now it's kind of slowed down a little bit. But
Well, and that's what's got me worried, kind of hemming and hawing, because I had puppies during COVID, which was when the market was super hot. And the only puppies I sold were by pure word of mouth within our... All my puppies went to somebody within our world already.
And about the time you think it's not going to fall into place, somebody, like the skies open up and somebody magically drops into your life and they're the right person. So I've had people puppies born with, one ear, with abnormalities to a leg, so they're 3-legged as babies. Things that happen, and they'll be like, "Oh, I think I should just euthanize him." Like, no. Just wait. The right person will come along. And lo and behold, it always does. There'll be somebody, they'll come back in for their puppy check at 8 weeks, and they'll say, "Dr. Greer, you won't believe what happened. This person called me and they have a child with the same disability and they want this puppy." I'm like, well, there you go. It just works out. So Jonah was meant to be your dog.
Yeah.
And they're from the 2 different sires.
We've had 3 Eurasiers, and we were always told from day one that it was going to take a year or 2. Get on the list and wait for a dog. And I don't think we waited more than 6 or 8 months. And it's because we attached to the proper networking group that we needed to be with and got to know them. We're following the protocols, get to do that. There's breeders out there in our Eurasia world that don't follow the proper protocols, and they're charging exorbitant prices and holding fees and things like that, and things that we just don't feel are ethical.
So you became known as a good home.
So it was just, yeah.
Because people
So you
know us.
fast tracked.
We put a
Right.
original. We went to Geneva, Illinois for our original meetup with Eurasia Club annual meeting, and we were supposed to go to Mackinac Island that year, that weekend. And I said, let's just put it off and go down and meet some dogs, meet some people, because we were already members, but we weren't sure if we really wanted to get involved with this. And once meeting the people and meeting the dogs, we were like, yeah, this is what we want.
Yeah.
But walking in, the girl asked us a couple questions. You know, do you have a dog yet? No. What are you looking for? Oh, I know somebody that just had a litter. Let me call. Oh, no, they're all taken. Well, the breeder that had the litter contacted us the following Monday to say that somebody changed their mind. And so she had an available pup.
I'll
So
fast
that's how
track people
quick
like
it
that
can
too.
turn.
If somebody comes to a dog
Dogs,
show
yeah.
specifically to see my breed and I like them,
Yeah.
if I don't have anything, I'll search for a puppy for
Yeah.
them.
I
Yeah.
do too. I will say,
Two of the dogs that we placed the owners came to us through other breeders that said, hey, we've sold dogs to these people before,
Yeah.
they're a good home, stuff like that. So
And
yeah,
that's why our USCC site, people will go to there looking at the breeders, but it goes to the board, and then the board meets out,
Yeah, see, we don't have that.
and it just seems to work out.
Yeah, do you have a Facebook page for your breed?
for the breed,
We have our mother club of the NEAA, National Norwegian Alcon Association of America. I'm not listed on it. I've been asking for 3 years to be listed on it. The website has been deserted. They asked for a volunteer to put our entire website up. Okay, you can't.
it's not about.
Mary doesn't have enough hours to do that in a day.
Yeah.
So it finally got into a business, but the business has had it for 6 months and there's nothing done to the page.
Yeah.
I don't know what's
So
going
is
on.
there a Facebook page? Is
That's
there a
it.
way that
That's
the
it.
Facebook page is the website, or the website is the Facebook page?
And they're both completely dead. There is no
Yeah.
social media for Norwegian Outcomes.
Yeah.
Because you have to remember, we're one of the newest and youngest members to that club.
Yeah. Yeah, because our farm dog club, that's been my greatest source of information. For corgis, I've been in them so long that everybody knows who we are.
Yeah.
But for the farm dogs, you know, we're a member of the club. We're listed as a breeder.
Yeah, I keep trying. 3 years and counting. I'm not on it. Jasmine's not on it.
Well, what about Waukesha Kennel Club? Are you a member of Waukesha? Because they have a breeder directory, and you can pay for a listing with the breeder directory. I think it's like $10 a year.
Okay.
It's the hardest thing to get somebody to update the website and the Facebook page if they're not doing it because it's an old habit that they got out of, that they have to reestablish. And we were questioning when we got affiliated with the Eurasians about, well, if this person isn't breeding anymore, why are they listed as an active breeder on the page? Because now you're
Oh yeah, we weren't
confusing
doing that.
people. Yeah.
They were just learning. They
So-
were starting to stalk certain people, and we ended up being stalked by the same person.
And we have a list on our website, too, of breeders.
mm-hmm. So is the
Your
JRTCA.
vet clinic does.
Her vet clinic
Yeah.
does,
If you're a
And-
member
yeah.
of our breeder consortium group,
And it's
yes.
worth the money.
Okay.
It is. Because, I mean, just, no offense, I spend a lot of money here sometimes.
I do too, but I didn't want
Oh.
to join because I'm not big on joining anything.
No.
we
it's
decided
worth
to
it.
spread it around. This isn't the only vet clinic we spend a lot of money on.
Yeah.
But networking is networking. You
But-
have to network.
Yes.
But she's
Well,
she's referred 2 people to me. Or
Yeah, but
their
Jack Russells
clinic.
are a lot better known than mine or yours.
My sister had a Norwegian outcome years ago, so I've heard of it.
What is the?
If you're
It's
a member of our breeder consortium, then we list you on as a breeder on our website.
Well,
And
we're
that's
on-
I
successful.
found them in a
Maybe from
magazine, and it was a
number
it was a
I
just
tend to
big
get
magazine.
more
Been alive for
from
2
puppy,
years,
half breeder.
and then
My
there's some other
Facebook page.
criteria.
And there was
So
one
we've got a
individual.
form to fill out.
Puppy
You can
Find, which is now
Go over and ask for it
puppy.com.
before you leave today.
Okay.
So we were, yeah, we
It's
didn't.
like a
And
loyalty.
I didn't advertise on any of those.
It's like a
And
loyalty club.
puppy.com
Yep,
is
okay.
like, I don't know,
So
$20,
Do you get-
$10.
Do you get like a little
And
discount
then
when
you
you?
can actually turn it
So am I
off,
already a member?
where you don't
you're
have to
not,
continue
you don't get discounts
to
at
pay.
the
But you
at
also
the
get a
health
lot of
clinic, but you do
crazies
get
from
discounts for
them.
other things.
I wondered about that.
For services.
Oh, I did
for
miss
some
the
of
one.
I think you knock off like
I'm
10%,
listed-
15%.
Outcomes
Yeah,
person?
we've got
Are you
some
able to-
criteria.
Can I look at it?
Oh, it's all
Yeah,
back there.
they have a.
I'm
They
also
have a
listed
form
on
at
the
the clinic, so if you
JRTCA
go over it before
website
you leave
because I'm
today
in their
Yeah.
directory.
and ask for the breeder
as well.
consortium form, they'll be
Yeah.
able to give it
So-
to you.
Okay.
I tend to
No, I mean, I
actually
wanted
get
to look,
more
like,
off
see-
of
What,
the
the
Facebook
website?
page
Yeah.
than I
Yeah.
even
What
do
is the website?
from the
SmallAnimalClinic.com.
JRTCA group.
Small
So
animal.
how do you
Small
make yours
animal
public
clinic
for an
dot com.
algorithm? I mean, I have private ones that I
Or
don't want anybody seeing that we
smallanimalclinic.net if you
discuss.
forget.
So when we had our litter, I created a private Facebook group
Yeah.
that I added, each owner got added to it, and I also have us, the breeder for the males, and some other breeders and other people I know, and
Some of our mentors.
Some of our mentors. So when these owners want to
I'm
ask a
gonna grab that. I'll
question,
be right
they don't
back.
have all of Facebook jiving in on it, you know.
You just have our small group.
Yeah. So it's just a private.
But
Oh,
and it's a
14
really nice
people.
way for people to get in touch with each other and see
Yes.
what their litter mates are doing. And
And
that
that
one.
is really interesting because I've actually had 2 puppies.
I bet you if you buy it,
They were both in
put it on my
Illinois.
account, you'll have enough.
But the one guy
With
lives
the
in
Irish
Florida
one
6 months
again,
out of the
I
year.
just need-
And the 2 of them get
good.
together
Are you sure?
with their
Right, right,
puppies.
well,
And
you know the
then
business.
the other puppy person is up in Rice Lake,
I'm
Wisconsin.
gonna steal it.
And they're like, well, where are you at? Maybe we can get together, which
don't
I
think
think
know
is
that
super
much.
cool.
I don't know,
that
I
they're
don't know that much
doing
about
research.
anything completely.
yeah,
Anyway.
your group is a pretty interesting group.
It's a good group.
Are they really close knit?
Yeah, we're pretty small.
Because you're still importing, right?
We tried to import, yeah, I mean, it's hard to get a dog out of the German sometimes.
You could, yeah,
so,
you could
but-
have a
Good
nutrition
dog.
issue. I
Yeah,
Yes, there you
good
go.
dog. We've had some that they got and like 50% didn't pass all their health tests by age 2, you know, because thyroid's our biggest thing, and they failed.
Yeah. Sometimes
I got a dog on
you
Be
know,
Strong.
other countries will not send their best dogs. I've been really lucky with my farm dogs that I've been connected to the right people.
But not
That was my question.
not all, you know.
Yeah, that's for welcome.
Yeah.
Just
Like
And then
after
it's
they
really
have
interesting because thyroid is our biggest thing, and I forget which country, but there's like 1 or 2
I
countries
would-
that
I
say
would
we're not
switch to
gonna
that.
test for it.
I'm
Yeah,
not a
that's the
pretty
biggest
guy.
thing.
That
But,
eliminates the problem
I would try
altogether,
that
doesn't it?
raw
Yeah,
food.
they
Yeah.
don't know they have it.
Put your head in the
So-
sand.
I know.
And of course,
Probably
those countries will send
$100 a
dogs
bag,
to us
I'm
if they
sure.
ask, but we don't know their health background. And we're trying really hard to stay on top of that health. So.
One of the
I've
things
been
about
really
gatherings too is we get to meet people
Who have you worked with
that want to
for
come
work?
from all over. We just had a lady show up and she moved to Madison from nowhere.
Lars,
And she has a
Aidenheimer, and Eric
And
Carlson over in
bigger than
Sweden
our-
have been really good to us.
But he's Riverdale's like 60, between 60 and 65 pounds, and the standard goes to 70.
But I just got
It's
lucky.
bigger in the States because there's
But
more.
I also have a pedigree that
And so she brought
I
it
look
by
like a
from
pretty
Madison.
good
It's like
person to
an
sell
hour
a
and a
dog
half door,
to.
2.5 hour drive from the house to my house.
I mean,
And
really.
was like, he was from.
you know, we were 30 years in dogs before we got our first farm dog, so I wasn't, you know, I come with some credentials. So that helps.
We come with no
The
credentials.
You know a thing or
downside
two
to
'cause you've seen a
Facebook
thing
is
or
that if you
Yeah, there's a commercial like that, isn't there?
don't place a puppy with them, they will say nasty things about you.
Oh, yeah.
And
Well, what's the one you
they'll
had?
they'll say it right on your Facebook page.
So
Yes,
we
that's
just
not
we tried
necessarily a
to
bad thing.
breed Lucy. We tried to breed Lucy just not too long ago, and it didn't take. And this lady was like, you know, when are your puppies gonna have young? Like, we had nothing for you because we literally had no puppies.
Mm-hmm.
And she kept saying, when are your puppies gonna be on young? I will come to your house and.
And then we were at Purina Farms for our national, and she said, I have your address, I know where you live. I'm like, good luck with that, because there's nobody home.
We're already in
I
it.
live by over to March. Just come to March. I've
Well,
got plenty of room for
I
bodies.
had one lady, and I just said, you know, I think this true story was that my comment was,
I guess they
we're
said-
not a match.
I'm sorry?
I think they said there was something.
And you get that a lot, because it's those long relationships you're having with people.
You want to poke a cop? A pop?
You can offer her, well, and I have such strict criteria. I don't have to
Well, I was
sell
gonna get up and,
therefore I
I was
refuse to
gonna
sell
get up
one of
and
my
get it
puppies
for
to a household with children, even though they're supposed to be good with children, because we were not raised with children.
That's a lot of our
One
breeders
of my
will
plans is to
bring
bring the
people.
neighborhood
We
children.
bring the neighborhood in.
Well,
Yeah, but we live out in the country, I have no neighborhood
And
children.
we tried that because of the COVID was an issue there, but
She's a couple of
right. Yeah, but
And you can tell because when you go to reach, she's the you raise your breed, handy stand off. It's just like your Spitz. And she is one of those that when you reach for, she's like, wait a minute.
you know, we have nieces and nephews that are in scouts. We tried to get a scout group to come in, and we had it all lined up, and then COVID hit.
Yep.
And it's like, no, that's not
So
going to
she's
happen.
comfortable.
They did get passed down the bar, though, I'm not going to lie. I took
Oh,
them
yeah.
to work and they got passed down the bar.
There's nothing wrong with that.
I'm sure they were drinking beer and wine and a few other things.
Did it hurt him?
No!
All right.
All I did was get yelled at that really was not, you know, what we should be
Sanitary?
doing.
Usually
And I'm like,
when she reach for, she jumps
we
back.
disinfected the bar.
Yeah, what do you think they're going to get at the bar? You're gonna get parvo from the bar?
Okay, we had COVID, so we had to take the bar stools away, but it's Wisconsin.
So people just bellied up to the bar without stools.
3 deep, and then ditching that, we have to bring the bar stools back.
Yes.
So
You had to take the bar stools out?
when we were at 20% capacity, when they brought COVID restrictions lower, we were only allowed to function at 20%. We are an independent restaurant. We are not part of a chain. We almost lost everything. Because to begin with, all of us lost our jobs within like a 3 hour when he said you're shut down. We were done. Yeah.
Where?
Fire test.
Oh, really?
You know, the local alcoholic and that's where I took the puppies for socialization because everybody was still at the bar.
Brilliant.
So, yeah.
Yeah, you do what you have to do.
Is there a new parvo strand going around?
The one that originated in Michigan, right?
Nobody's saying if it's new or not.
I've heard it's new variant, and I've heard her crew was not properly immunized from
Well,
the original
I
part.
just read that adults, even vaccinated adults, were getting this because it's a new strand that the vaccine.
I don't know if anybody really knows that.
Yeah, I figured it seemed a little. I haven't heard anything personally about that going on.
No, it was a big deal for about 6 weeks, and now it's quiet.
Because we're dog breeders? We don't say that word.
Well, no, I was really worried about it because we were going to Marquette at that point because Marquette had the 4-day dog show. And I said, but I've heard nothing since except that she had not properly vaccinated the dog, period.
Yeah.
So probably the truth versus fully vaccinated.
But not every dog responds to parvo vaccine. There's a genetic tendency to not respond to the vaccine.
Really? I did not know that.
Yep, we have one client who did titers on her bitch, and Dr. Schultz at the vet school said, don't breed her. She will pass that on to the puppies, and you will have non-responders. So somewhere around 5 to 10% of dogs are non-responders to the vaccine. So she may have a line of dogs that are non-responders. But, I mean, there's just certain genetic things that happen. Years ago, oh my gosh, this is 30 years ago? 25 years ago, we had a dog that came in that ultimately was diagnosed with avian tuberculosis. And I walked into the office one day, Dr. Moore was on the phone talking to somebody, and I'm like, who are you talking to? It was Jim Carpenter, who was a pathologist at Marshfield, and he had written the original papers about a line of basset hounds, and now there's a line of schnauzers that are vulnerable to avian tuberculosis. So they got TB in their lungs from birds, and it shouldn't happen in dogs. It should not be an infectious disease in the dog, but certain dogs didn't have the ability to mount an immune response, so they got avian tuberculosis.
Interesting.
So
he keeps writing you love notes.
He's going to bring in flowers next.
Okay. Sorry for interrupting.
So there are certain dogs. There are certain dogs that don't respond to parvo vaccine. Mostly Rottweilers, Dobermans, and Pit Bull Terriers.
So the Mastiff types again.
The Mastiff types again.
I don't know. I just can't do it.
They just don't. So it's not that those dogs get parvo because people don't vaccinate. It's just that they are vaccinated and they don't respond. So we see certain dogs that just don't mount the immune response, just like in people. You know, not everybody like who had corona and who didn't. Were you vaccinated or not? That's not a guarantee. Being vaccinated for corona doesn't mean you're not going to get the disease.
No, I've had it 4 times.
Exactly.
My brother's dog died years ago of leptospirosis.
Leptospirosis.
So I yelled at him over the phone for not having his dog vaccinated. And then he called me back and said his dog was vaccinated.
At that time, we could only vaccinate for 2 strains. Now we can vaccinate for 4.
Yeah, he had 4.
But there are 7 strains.
Yeah.
Was this for Bordetella?
For lepto.
Oh,
so, like Bratislava, leptospirosis Bratislava, we know dogs get it. It's not in the vaccine. We have 4 strains in the vaccine.
How about Blasto?
There is no vaccine for Blasto.
No, only
really nasty treatments.
We lost our first Eurasian pup at 1 year old to blasto.
Well, I thought it was interesting that they asked me to speak about blasto. So this spring we lost 3 Labradors to Lyme nephritis. Had 1 golden retriever sick and lost 3 Labradors within a 2-month time period from Lyme disease. So and I think Bernese Mountain Dogs are more likely to get Lyme disease from what I've read and what I understand. So there's just differences in how the immune system works. Usually blasto and the other fungal pneumonias we see in 2 to 4-year-old dogs that are new to that part of the country, and the same with people. We lived in Arizona for a number of years when I was a kid, and people that grew up in Arizona weren't likely to get coccidiomycosis, but people that moved there as adults were, because they just never developed immunity to it as a kid. So your immune system does some interesting things. Sometimes it's really good and sometimes it's really bad.
And that's why the nutritional part of your animals and yourself is so important, because if your immune system's strong, you usually are going to be able to fight off most of the things going on, and that's the key. And most people are, I hate to say it this way, but I'm going to get my COVID shot because it's going to keep me safe. It's not going to keep you safe.
Yeah.
It's not, because it hasn't been proven to keep you safe.
Right. It'll help, but it's not a solution to everything.
Don't listen to the government, because they're going to tell you just to get you to go get it.
So, aren't we in a hot area for blasto anyways?
Yeah.
This part of the state, not as much as when you go up to the Rhinelander area, but yes.
What is blasto?
It's a fungal pneumonia.
Blastomycosis.
Mm-hmm.
Oh, that's what I was asking. That's what the honey goats get in their lungs. In their lungs.
It usually shows up
throughout the whole body.
But it can show up, like we're watching our sister-in-law's yellow lab right now, and it had blasto and it lived, but it ended up blind in one eye. And then our dog sitter had a boyfriend with another dog. They used to walk at the same place where we walked our dogs, and their dog started to show up with blistering on the skin, and they thought it was a rash, and it was actually blasto.
Yeah, it's a spore. It's a fungal spore that lives in the soil, and when the soil is disrupted in certain types of soil, so that's why certain parts of the country have, like histoplasmosis is a problem in the Missouri River Valley, and coccidiomycosis is a problem in Arizona, Utah, that part of the country. Northern Wisconsin is a problem with blasto. So the soil has to have a certain pH, a certain, like wood chips are part of it, so and certain pH and certain temperatures, and
it's decaying matter. We had a guy that because the park we walked in is a little creek called the Pipe Creek, and it flows through and it flows out to Lake Michigan, and in the spring it swells up and comes down, so it's eroding the bank. And so this guy worked for the Corps of Engineers, and he actually, I saw him out there, and he came to my church to talk to somebody else one time, and I said, "Weren't you over out at Petrified Springs?" And he goes, "Oh yeah, I was there with the Corps of Engineers, blah blah blah." And I go, "Well, you probably saw me out there. I had 2 giant-sized malamutes with me." And he's like, "Yeah, I think you look familiar." And he goes, I go, "Yeah, we just had a Eurasia and I lost it too." And he goes, "Blasto." And I go, "Yeah." And he goes, "I was diagnosed with it too. They took a golf ball-sized lump out of his lung because he contracted it because he was that close in contact with it."
We had a client who's had 2 sons that got blasto. They were tree cutters.
Yeah.
And there was a situation probably 20 years ago up in the Rhinelander area that they had on a Saturday morning at a garden center, they had this educational event, and everybody was there. 120 people got blasto that day. It was across the river from where an old wood mill had been, and so the wind was just in the right direction, and all the right things just had to happen. But 120 people got sick.
So you're speaking of gardening. I'm doing back to Eden with black leaf mulch. Is that going to present a problem? I don't do the wood chips.
Yeah, wood chips seem to be the bigger problem,
Okay.
but you might want to just do some additional checking on it and make sure.
Yeah. I also put mycorrhiza down.
Yeah, I don't know if that helps. I'm not sure.
Okay.
But I've had people say, "Yeah, I've had 2 dogs with blasto." I'm like, I hope you've moved. Like I hope you sold your house, burned it down, or did something and just moved away, because once you've got it in the soil, it's there.
You're probably a little bit aware of this, but I know what we've read that it takes like 5 to 12 weeks to show any symptoms of it. And so by the time our dog started showing it, it was already in one lung, and we took him in and they tried to treat him, but it crossed into the other. And I do tell people, know your dogs. Know what normal is for your dogs, because I started to see things that weren't normal in my dog, and we kind of put it off as, we'll just wait a little bit. And then as it turned out, he was past the recovery point of having blasto. And I just knew something wasn't right with him.
Yeah.
I couldn't tell you what it was because I never heard of blasto before.
Yeah, I've had 4 cases of it in the prostate. And that's, if you look at the literature, it says in a footnote, blastoprostatitis can occur. Well, that's not very helpful.
No.
But we've seen it enough times to now identify it. So the fourth dog came into us because he was a 3-year-old retriever, and the veterinarian had seen him and said, his prostate doesn't seem right. So she brought the dog in, and I took one look at him and threw the ultrasound probe on him and said, his prostate's too big for a 3-year-old dog, something's wrong here. Did a blaster test on him, which is now a urine test. It's much more accurate than it used to be. Came back positive, started him on medication, sent him directly to the ophthalmologist, because I said, this dog's going to end up with vision problems, because it can end up in the skin, it can end up in the lungs, it can end up in the prostate, it can end up in the eye. I've had one dog develop blindness in both eyes. Sent him directly to the ophthalmologist, and they were able to save the dog's vision, save the dog, but only because we've seen 4 cases of it in the past.
And she did a lot more reading, and she noticed that one of his testicles enlarged, and that was when we...
Post, I mean, you realize it post after.
Yeah, it was like, you just go like the things you don't know, and then all of a sudden you're seeing something that isn't right. And I go...
I lived in Wisconsin my whole life, I never heard of it.
Yeah.
It's like,
Right, but this part of Wisconsin, it's not as common as when you get up into the more northern part of the state.
Right.
So there's pockets.
The original cases, I think, were further north central, and we're down in the Kenosha Racine area,
Yeah.
so it's...
Yeah, we rarely see it in native dogs to this part of the state, but if they travel, if they hunt, you know, if they're out and about, then we can certainly see.
And I heard male dogs 1 to 5 are prone to it, cats and some people. So male dogs 1 to 5, what are they doing? Nose to the ground. So
Yep. Digging, doing all those wonderful things dogs do.
Yeah.
so is it bad to have mulch in your yard then? That's just like walking past?
That is a concern, is mulch, yeah. But how do you know where the trees came from? Because they don't come with a identification on them. So yeah, wood
Well, like
shavings
for
are a
instance,
problem.
we got some mulch from the city because we have an area that's between our deck and the woods that just doesn't grow grass, and these guys are tearing it up, running through it, and getting it all muddy in the spring, so they come in all muddy and track mud. So we just mulch the pathway there, and I continue to mulch behind our pole barn, which is it's a loop for them to run on. It's what it is.
That's when pea gravel looks much better.
Yeah.
I noticed it there, but that's your beard.
So, other questions?
Got everything answered?
Well, she is a lawyer. Should we start the contract talks?
Okay,
She does, do you have, she does have a great partner,
We have done
Sheila?
we have done contracts, and I've looked at multiple contracts and kind of like sliced them apart and built my own. But
We used her partner Sheila, who helped us with our contract.
Yeah, she's retiring, so she
Oh,
won't be
no.
doing that anymore. Yeah.
Oh, no.
Hold on to your contract, it won't happen again.
But yeah, she was great to work with.
She is, is, yeah.
Yeah, we have to alter it one more time because since I'm not going to be listing specific genetic things and not just leave it open. Because in 14 years I don't want somebody to say, well, there's a new test and it's genetics, now you owe me.
Exactly. So, other questions?
At this time.
Okay, good.
Oh, you can go eat with your husband or whatever he's been testing.
He's gone.
He left.
Can't you see her smiling? No.
He left. He went home, let dogs out, take puppies home.
so
Aw, no puppy visit?
I think he left with them.
I took them all out to go potty. Xander's a little more awake, but he's still walking like a drunken sailor.
He's stoned out of his mind.
He wouldn't.
I'm sure he is.
The hips.